So good afternoon and welcome to the closing ceremony for this bootcamp on COVID-19 that we started last week on Monday and allow us to design innovative medical device solution to fight this pandemic. Let me share the screen with the program of today and few numbers of the bootcamp. I hope you can see my screen.
Yes, sir, we can. Closing ceremony.
Thank you, Victor.
It's kind of so sad that we are ending it.
So, this is the program for today. We will have a very brief introduction by me and by Dr. Victor Conde from ECA. Then we will start with the project presentation. Each project will have approximately 5 to 6 minutes to present and give also room for discussion and for question. We will divide this in 2 slots with a short break around 4:30, when we will have also the greetings from Jana Randa, EngineeringForChange, who supported this bootcamp, providing support for the Facebook group, providing support for mentoring. Then we will restart, of course, the project presentation, and by the end, we will do an awarding ceremony and closing remarks from DCI, UNESCO, and East DCA. Finally, I mean, we have to find a way to have a virtual toast and say goodbye to the next event. Just recapitulating where we are and what we did. So this bootcamp came from an initiative from ECA, UNESCO, and DCI with the idea to empower the youths of African continent as a method for promoting innovation as well to solve real problems that may arise to this pandemic. We received a very large number of applications covering with participants and mentors practically the entire world. We had a lot of African countries represented, around 30 countries, both north, south, and west. Apologize, there is like noise. But we had also people from Mexico or United States, Europe, India, Singapore. So a very worldwide community. Of this large number of application, we selected 105 participants according to CV and motivation letter. Of these 105 participants, we are happy to say that looking at the indication of your mentors, like 70% of you attended on the classes and actively participate in this bootcamp. Victor, can you mute your mic, please? Then, I mean, in these 2 weeks, we had time to listening, interesting keynote speeches, not only technical regarding the viruses or the technology, but also on economic point of view, and also very interesting classes on. Of course, we are here for designing, so it is important also to have a view on technical aspects. This is the program. We had very interesting webinars from representing initiatives that in Kenya, in Uganda, in Malawi, were aimed at creating medical device that can be useful for the population. Not only designed, but also locally produced. So I'm really glad to say that thanks to this bootcamp, we were able to create connection between research group and entrepreneur that was not possible before. The bootcamp, as I already said, allow us to design and create medical devices. We go through the identification of need, conceive, identification of standards, also local standard, as demonstrated in the case of Malawi. And then we spend a lot of time doing conceptual design, but also doing a lot to sustainability. We use the UBORA platform for guiding our design process, and this framework we hope can be useful also for your future career. Now go to the point to this bootcamp. This is, we are all friends, but we are doing a sort of competition. So we organize it in groups with mentors and super mentors that helped you in this design, looking at solving the issues in 4 tracks: diagnosis and testing, therapy, contact tracing, and of course, protection. We are going to listen and to look at your projects, and we will evaluate them according to their technical implementation, documentation, presentation, and impact. It is important to say that all the people present in the chat will be able, with an instant poll, to evaluate your project. At the same time, all the mentors received an Excel file where they will be able to identify and vote for your project according to technical implementation, presentation, of course, impact. And we will have like a special jury who is at this moment looking into the documentation of your project on UBORA. The contribution of these 3 parts will identify the best project that we will try to support in future implementation and to like a spotlight in all the platforms that supported UBORA. Remember that we have also the Best Photo Video Award. Later you will discover the amazing prize that we reserved for this. People from DCI will explain in what it consists. And finally, I want to thank you all the institutions that together with ECA, UNESCO, and DCI supported this initiative. A lot of universities and research centers allow their workers to be here and help you in this design. So this is my last slide, and stop also my screen sharing. If you don't have any question now regarding the evaluation procedures, I will invite Dr. Victor Conde to give a speech about and greetings from ECA. Is Victor there?
Yes, I'm here.
But I'm sorry, I received the text that there were some problem with the audio. Can you confirm that you had this problem?
No, I don't have that problem.
Okay.
I think it's from my end.
Okay. There was like a microphone that was not able to mute, but okay. So Victor, you have the microphone.
Okay, thank you very much. I actually do not really have a speech per se, so I'll just have a few maybe just remarks to make. And then, of course, the number of people that perhaps I personally need to thank in organizing this bootcamp. The idea of a bootcamp, I think, took quite a bit of time. So it was organized within a short period of time, but it actually involved quite a lot of intense deliberations with colleagues and from different institutions and different countries. So just to give some background for those colleagues who may be new, is that the bootcamp, although we called it a bootcamp, actually ECA in general and together with the African Biomedical Engineering Consortium have already organized, I think, annually one Innovators summer school. So basically the two students are selected almost in the similar way, but they are selected not based on their CVs, but based on the quality of their own projects that they have been working on over a long time. So as we speak, I think if Camilo has not told you, there is actually already a group that are being shortlisted for the summer school that is going to take place in Malawi. And therefore, this is really an activity that has been going on for a while. And this bootcamp is basically tailored around it. So for many of you, perhaps I should just say that the design of the bootcamp, when we started, which is way back in 2012, is actually borrowed from what we call the entrepreneurship training workshops, run largely by UNCTAD and UNDP, and basically a program that was developed many years ago with the help of colleagues at Harvard University. And around it was the idea that we put people actually literally under pressure to try and get them to do things quickly, because basically that's how life is. You will not be able to say, give me time to think first. As innovators and as entrepreneurs, as scientists, you will be required to think on your feet. And so if you found the bootcamp a little demanding, it isn't Camelo's fault. That's something that has been in it for quite a long time. I still remember the first one, a number of professors coming and saying, when will students get the time to do this or do that? And my answer was always very, very, very simple. They will find time. They need to create it. Time is something we have to create. If you're going to be a business person, or even if you're a farmer, your farm doesn't go to sleep. So in a way, that is something we are hoping you actually learned. Among the things that the bootcamps actually intended to do is, one is to promote innovation. And I'm hoping that you have actually learned something. If you spend 2 weeks and you haven't learned anything on how to become more innovative, then well, we have failed you, and perhaps you failed us too and failed yourself. So I'm hoping that this bootcamp was actually successful in that regard. It is also about instilling entrepreneurship. One of the questions in the early stages everyone asked was, we are going to train all these young people doing their biomedical engineering programs at universities, but who is going to find them jobs? My answer was normally very simple and still the same today. Part of it, we need to learn how to build our own industries. It's those industries that will create jobs. Now, they may not be just for everyone building their own firm. It may be groups of people building up a firm. It is possible one person will be very successful, and around him, he'll employ thousands more. Why not build the next Huawei of this world in Africa, and then you can employ thousands of people? Then that's the way we reduce unemployment. And the second is the skills that you learn. We are hoping they will be adequate for you to apply them in any other area of fields of technology, fields of business, and fields of life. So that's what we are hoping, that you actually learned a little bit of entrepreneurship skills. The third element is basically to impart what you call technical skills. And I'm hoping that is something perhaps Camilo has spoken about that you have done. And I'm hoping you did that very well. In which case you earn some new skills that you can go and use back in your own research, in your own projects in future. And finally, of course, is trying to get us to learn how to work in groups, as building what you call partnerships. I think we're a continent that, like, almost every man, woman is a mountain on their own, each one wanting to build their own business, or each one wanting to build their own technology alone. And in the world today, just look at your phone and ask yourself how many technologies are inside it and how many people are actually required to get it to work. So in a way, we are hoping that your groups that you've worked with, including those people not in your groups, including the people you have met, you will actually stay in touch. I still, one of, I think our Facebook groups we created maybe in 2014 is still there even today, and more people, some people are even joining, and they still discuss amongst each other where they've gone, what their careers look like. And I'm hoping that this bootcamp has lived up to that. It is also perhaps our first experiment to hold a bootcamp online, or a school online. because all of them have been physical, and this is a unique one. So I'm hoping you all provide new lessons that we can use in future in designing maybe other schools. So that's one thing perhaps I just wanted to highlight, so that you felt the school was perhaps very kind of tight. People need you to be here and there, and I could hear when we were starting that, oh, they are still in their groups trying to finalize projects. It's not because it's virtual. That happens at every summer school we have organized. Every groups will be running around on the last day to try and finalize their projects. So that perhaps is something I just wanted to highlight. And finally, I just want to say, it's not just about you, it's also about us. We also learned quite a lot during this time. We made a lot of friends. Just to give you an example, I mean, all of you are talking about Engineering for Change, joining us. Actually, I didn't even know that before this, we started doing this, this work. But then in discussions with colleagues from Philips Foundation, then they said, well, we work actually with a group of engineers in the US. So, and one component of that association of engineers will be maybe something that may be interesting for you to work with. And then they introduced us, and here we are working together. So in a way, the same thing, I think, with our colleagues from UNESCO, our colleagues from the Department of Science and Innovation. We have worked with them over time, and through them, we met a lot of other institutions that are supporting this bootcamp. So, you know, so on that end, I'll end by thanking everybody, especially all your mentors. Quite a number of them, I wrote to them personally to invite them, please, this is what we are doing. Can you support it? And they graciously agreed to actually devote their time. And to them, we are very, very grateful. And also, of course, to all our partners, our institutional partners, ECA, or Engineering for Change, the Department of Science and Innovation, UNESCO, as well as University of Pisa, for agreeing actually to host it. Because, I mean, we would be all of us running around very heavily if it wasn't for them actually taking up most of the work. And on that note, I would want to end by wishing you all the success, not only for now, but for the future. And I look forward to listening to all your nice projects and see how far they've gone. I've always said we hope that some of them actually will get market, but my main target is basically just the 4 elements that I have outlined, and I hope you will learn something from that. And with that, I thank you very much.
Thank you, Victor. Thank you again for challenging us in organizing this school. So let's start. Let's start immediately with the presentation. So I'm inviting people from group 1 to take the lead role and presenting their project.
Can you see my screen?
Yes.
Okay.
Yes, thank you, Fana. I can see your screen. Sound check, can everyone hear me?
Yes, we can hear you.
Yes, we can hear you, sir.
Good afternoon and welcome to the Group 1 presentation. My name is Brian Watai. Team 1 presentation is about COVID Auxi Kit, and we named ourselves Team Nguni. Now, on COVID Auxi Kit, COVID Auxi Kit is a complete personal protective equipment package that contains filtered mask up for sterilization, reusable face shields, and portable UV light sterilizer. And the whole kit is designed to minimize the risk of exposure to corona infections for health workers at their places of work, but it can also be used in home setups for sterilization. So I'll ask Fana to move to the next slide, please. To our next slide, we have the table of contents, which runs from The first one, medical needs and conceptual design, all the way to growth strategy and sustainability. In our implementation of the project, we'll follow those steps. Next slide, please. Now, on the next slide, what you can see, that is the medical needs and conceptual design. Our 3 components in the COVID auxiliary kit, as I mentioned earlier, we have an enhanced face shield, and which is on the far left, as seen on the screen. On the top, it has a cap, and yes, it has a cap. You can see that. Then it is designed in a way that on the covering of the head, it is transparent, so that the person using it can see all round. In the middle, we have an enhanced face mask. We decided not to dwell so much on the face masks because there are other well-designed face masks on the UBORA platform, and we'll choose one from them. So we focus much on the enhanced face shield and the portable UV light sterilizer. So you can see the portable UV light sterilizer is designed in a way that while not in use, it will be covered to protect it. And during use, you will remove the cover when you want to use it, just to minimize exposure to risk and to protect it for a longer period of time. Please, the next slide. So in our project, we considered several regulation and classification. So on classification, our face mask and face shield are under class 1, and portable UV light sterilizer falls under class 2A. And the whole COVID auxiliary kit is class 2A. So above regulation and classification, there are also some standard of interest that we considered, like the ISO 15858 UVC devices, safety information. On the safety, we have incorporated another circuit in the UV sterilizer, so that when it is switched on, there is a delay circuit for 30 seconds to allow the operator to leave the room before the sterilization process starts, just to ensure that they are safe and protected from the UVC rays, which are to some extent harmful to human health. So we considered some standards like that, and also other standards to ensure the biocompatibility and safety, as well as to take care of those who will be using the kit and the sterilizer. Thank you. That is my part. I welcome Fahana to take the next part.
Hello, my name is Stacy from Kenya. I'll be taking you through the next 2 slides. So as you can see, here we've outlined our design and prototyping. On the left, we have our design for the shield. As you can see, it has a cap to make it more comfortable to wear, and the material that will be used for the visor is easy to clean, that the shield is reusable. Our lamp also, as you can see, has 3 bulbs and a covering, just as has been previously explained. Then there's a setup over there for a tentative sterilization, where you can see the lamp and the shield. Then in the middle, we have our electric circuit. Now we are fully cognizant of the fact that the UV rays are harmful to human beings, so we included a delay circuit, so that once you key in your timing for the sterilization cycle, you have enough time to leave the room. Then on the far right, there's a video. Fahana, could you play it, please? Yes, thank you. That was just showing, the removal of the outer covering that comes with the handle so that the lamp is portable. Next slide, please. Thank you. So over here, we've outlined our stakeholders and potential impacts following the class that we had last week. So for the consumers, we are targeting, healthcare providers. So I think our biggest market will be the hospitals, so that they're able to, sterilize the rooms where the COVID-19 patients have been occupying, and then also so that the healthcare workers can use the shields and the masks for protection. But it's also available for use at home for those people who will be doing quarantine in their houses. The producers, are local, wanted to do everything locally. So we're going to be having local manufacturing of the whole kit. Our partners include UBORA, UNECA, ABEC. They also included Philips, Africa Innovation Hub, because as we've been doing the design for the lamp, we'd like to include the UV bulbs that are manufactured by Philips, and we'd also really like their support in making the UV lamp. When it comes to potential impacts, speaking environmentally, that the shield is reusable. So, and the masks are going to be made from cotton. So our setup is basically very environmentally friendly. In terms of socioeconomic impacts, once we go into production, we're going to use the local manpower. So we're going to create jobs for a lot of people, as well as look at the social impact. The whole design process has, in itself, had a very positive social impact on us, the creators. We've gotten time to interact and learn from one another. So it has really done us a great service in bringing us together for sharing of ideas. So, and it also helped in, further protection of people from COVID-19. So, thank you. That's my part. Hannah, you can take over.
Okay, thank you, Stacey. Now I will share about the cost analysis, supply chain, and the growth strategy. So firstly, for the UV light, the price of each component was noted down. So each light is 15 euros, so the total price would be 45 euros. The electronic board is 30 euros, and the structure itself would be 10 euros. So we intend to sell this at 145 euros per unit, which will get 60 euros profit per unit. And we also aim to sell 10 UV sterilizers to 100 hospitals per year at the beginning with the support from our partners. And this will help us get 60,000 euros in the first year for paying salaries, marketing, office, and growth. So as for the enhanced face shield, the production price per unit would be 2 euros from filament and film printing, and the selling price would be 50 face shields for 195 euros, which will allow us to get 95 euros of profit per kit of 50 shields. So additionally, we can aim to sell 2 to 3 kits per person, making an additional profit of 15,000 euros per year. So moving on to the supply chain, our product starts from the R&D team, which is us, and then moving on to the manufacture and assembly at external companies, distribution of products, marketing and customer service, and finally to our target audience. So now I'll move on to the growth strategy and sustainability plans. So firstly, we intend to use components that can be reused, reduced, and recycled to minimize the environmental impact, and then expand the customer service to other healthcare systems in other countries, and adding more components to the COVID OxyKit. We will also sell our products online, as well as closer to patients such as nearby hospitals and clinics, listening to user feedback and improving our products based on your feedback, and finally ensuring continuous creation of employment opportunities for people involved in the supply chain. Now I'll play a video made by one of our team members to summarize the concept of our product, the COVID OxyKit. So lastly, thank you very much to the mentors and members who have worked hard on this project. It was a very eye-opening and meaningful 2 weeks for me, and we have also managed to complete our UBORA work packages and make it public. So you can view it right now by scanning the QR code on the slide here. And thank you very much for listening. I've come to the end of my presentation and would like to open the floor for any questions now. Thank you.
Congratulations. We have space for one question, if any, because I would like to keep the schedule. So if there are no questions, I invite the mentors to, all the mentors to start to fill the Excel file, and all the people present in the room, we can start to make a poll for team one. We have 30 seconds to vote. You can vote from 1 to 10. 1 is very low quality, 10 is a very high quality. Please consider the project in total, consider the presentation and the impact. I'll give you 20 seconds more. The majority has voted. We are going to take the average votation. And poll. So thanks again. I'm not going to share the results before the ending, but so I invite people from group 2 to present their work. Thank again, group 1, and thank again to your mentors. Group 2?
I'm gonna upload the slides, but I need some time for it to load.
Okay, take your time.
Hi, G.
I'm gonna share my screen now.
Okay. Okay.
Can you see the slide?
Yes, I'm going to mute the people who are not talking. Okay, I see there are another person of group 2 with the microphone open. Muhammad?
Yes, I can hear you.
Okay.
Yes, okay. All right, so I'll be starting.
You can go.
All right, G, are you ready? G, are you ready?
Yes, yes. Please start.
All right. Yeah, good afternoon, everyone. My name is Mohammed Abdulkadir. I'm the team leader for Group 2, and our project is a simple closed-loop system that factors in different constraints for different settings in the typical medical system, in typical medical center. So yeah, the product is meant to be a standalone self-regulated high-flow nasal cannula oxygen delivery system. And the reason for our selecting of this device is because of the shortage of oxygen supply in low resource setting and some countries, and also the fact that there is there's a high rate of death due to oxygen deprivation from even before the COVID-19, and then the conditions increased as when COVID started during the pandemic. And also our case study is reliable and cost-effective medical system. So we factored that in when we are in the process of our conceptualization. Next slide, please. So yes, this is meet the team. The name of our team is Team Simple, and the reason for us to be simple is because we want a device that is easy to use by anyone with little or no training required. Next slide, please. So yeah, there's the content of our slide. Next slide. So yes, like I said earlier, the reason for our idea, we have serious oxygen shortage around the world, and as the cases rise up to about 10 million, we've had severe cases of ICU and cases where the rural areas or various low resource settings don't have the resources to use to treat these patients. So there's deficiency in the required treatment for patients that require oxygen supply. There is even in cities of some areas, they are really having it rough with oxygen supply. In Congo, there's only 2% of healthcare facilities have oxygen. In Tanzania, 8%, like you can see on the slide. So there's been high. Sorry, can you mute, please? Thank you. So like in Congo, like the size, like it shows on the slide, we have 2% of healthcare centers with oxygen. In Tanzania, it is 8%. In Bangladesh, it's 7%. And like that around the world. In Sudan, they don't have any HFSS device in their rural areas and cases like that. And there have been cases of CBAP not being efficient enough to treat some intensive care patients during the COVID situation. And so we chose to solve that issue, close the gap of the shortage, and also increase the level of safety for the health patient, because we've had cases of health workers getting infected during treatment throughout the COVID situation and before then. Next slide. So yes, the clinical, I'll leave Dr. Asma to handle this.
Thank you, Mohammed. So what are the clinical needs we are trying to meet? As we know, COVID-19 affects respiratory system mainly, and patients present to hospital with many symptoms. Hypoxia is one of them. 80% of patients who develop COVID-19 have only mild symptoms and do not need hospital admission. 20% need hospital admission, and 5 to 8% need more escalation of respiratory support and admission to ICU. According to Africa CDC, in Africa, there are about more than 300,000 patients who develop COVID-19, and 160,000 are active cases now. And as we know, African countries are among countries with low or middle income countries. People who live in rural areas have difficult to access conventional oxygen therapy. And the shortage of ICU beds, according to a report, they are in all Africa have only 25 ICU beds, 11,000 in Egypt, 3,500 in South Africa, 3,300 in Cameroon, and Morocco have 1,500. And all other 50 African countries have only 6,000 ICU beds. So there's shortage of ICU beds even before COVID-19 pandemic. So people who present to the hospital with hypoxia and need conventional oxygen therapy, which is low flow oxygen therapy given from oxygen source like oxygen cylinders, mainly in rural areas, and delivered to the patient through nasal cannula or face mask. Some patients do not respond to this treatment and require referral to ICU beds. And the situation, next slide, please. This is situation in many rural areas. This is the hospital where I work. It is a rural hospital. about 80 kilometers away from the capital. We have only access to conventional oxygen therapy, and the source of oxygen is oxygen cylinder, which is of limited capacity, capacity of around 3,000 up to 6,000 liters. And sometimes we have no devices to monitor the blood oxygen of patients, like pulse oximeters. And when I interviewed one of the intensivists here in Sudan, and as we know, we have shortage in Sudan of ICU beds. There's around 200 beds all over Sudan. So what we shall do for patients who require ICU hospital, she referred to a device called high-flow nasal cannula, which may be used outside ICU settings, but unfortunately in Sudan there is no, this device is not available in Sudan at all. Next slide, please. Thank you. So our aim is to design or to develop a device which is self-sufficient in oxygen supply, which can be portable and easy to be moved around the hospital, and cost-effective, as I think high cost is one of the barriers from more advanced devices like non-invasive and high-flow nasal cannula. And as we know, the problems of energy supply and energy outage in rural and even in urban areas in Africa, we need a device which is energy efficient. And the device by itself, we need a device that's flexible, may give me low flow oxygen for patients who might benefit from this low flow, and at the same time might give me a higher range of oxygen flow up to 60,000 for patients who need escalation of management, so I can manage them outside ICU setups if I have no access to ICU beds. In the same time, this high flow of oxygen need to be warmed and humidified so not to injure the lining of the airways. And in the same time, I need an oxygen which is free of microbes and filtered. And I need to monitor the blood oxygen level while I'm managing the patient to decide whether to decrease or increase the oxygen flow. Next slide, please. So now my colleague will continue about concept and other parts.
Namelo, please. Namelo?
We're looking for Namelo.
I think he's muted.
Excuse me, guys. Where's to be the next speaker?
Yeah, his name is.
Hello. All right. I will get you through the concept of our design, considering the high flow nasal cannula. So, as we have seen the clinical needs, the concept evolves around producing oxygen, be able to monitor the flow of oxygen, the level of oxygen in the person, to avoid issues and complication that may arise. At the same time, bringing the product that is functional, usable, safe, and easy interaction. So, if we were to look at most of the systems, they are so complicated that there are different parts to make it functional, and that brings the cost up, and even the equipment that is actually used. It's heavy equipment, and for instance, here in Malawi, most of the oxygen therapy systems, they cost a fortune, and there are only a few, probably 17, and only working which are 14. So our concept was to make sure that the technology can be accessed can be easily accessed by most of the people. So our concept is to extract oxygen from the air and get to absorb the nitrogen, which is the major component in the ambient air or the room surrounding air. So after extracting the nitrogen, we'll have a higher percentage of oxygen, probably 90 to 95% of oxygen. So we start by using a concentrator that will absorb the zorrites beads. They will absorb the nitrogen, and this will be controlled by a microcontroller. Then the air from the concentrator will be blended again with the air from the surrounding to achieve the percentage that you want to deliver to the patient. So after getting to blend the air, we can now deliver to the patient at a high flow rate between 20 liters of oxygen per minute to up to 60, depending on the condition. And how will we be able to know how much oxygen percentage should we deliver? We include a pulse oximeter, which will be clipped to the finger of the patient to be able to know the oxygen level which are in their blood. So according to oxygen level which they are in their blood, through the tubings of the high flow nostril cannula will deliver the right amount of oxygen to them. And since we are looking and focusing in areas which they can hardly access these resources, probably they also have a challenge with electricity. So our system is designed to be compatible with solar panels, solar systems connected to a 12-volt solar and a deep cycle gel battery, which are not as expensive on the local market, and to be powering the system. And it won't consume much power since most of the components used are some are 12 volts and just a few amps. Even some of the components are running in milliwatts. So the power consumed, it's just very small. Next slide, please. Yeah, so this is the part of the hardware. I'll leave it to my colleague Tolis can explain a few, and I can come back on the electronics part after the hardware.
Okay, thank you, Namelo. My name is Terence. I'm from Zimbabwe, and I'll take you through the hardware components that make up our medical device. So as you can see from our slide there, our unit is made up of components that are coupled together, main being the oxygen concentrator on the bottom, which contains the devices that purifies the air, the atmospheric air into the oxygen that would want to deliver to the patient. You will also notice that there's a pulse oximeter at the top center, which measures the breaths per minute for our particular patient in question. Then the electrical components will then feed back and then ensure that there's the right flow regulated by the oxygen, the flow meter there on our left, top left. On the delivery to the patient, we're going to have the unit is shown by our mouse there, which is a delivery pipe of the purified oxygen to our particular patient, in this case to be a mask, which the particular patient will wear for the particular nostrils in order to deliver the air inside. This will make up the high flow nasal cannula passage. I'll hand over back to Namelo.
All right, thank you, Talents. For this system to work, we need electronics components which will get to work very efficient, and we need measurements and precise quantities of everything. So this is the circuit diagram that we have designed to be able to move the system, to be able to make the machinery work for oxygen concentration, oxygen intake, regulation of the oxygen levels, the air levels, and how much flow in terms of liters per minute is passing through the system, and then how much is being delivered to the patient. So our system basically is controlled by an Arduino Mega microcontroller, which is very cost effective. And since one of the principles for high flow, the rate has to be higher, we'll be getting to use the fan that will actually absorb much of the air from the surrounding. So the air that will be propelled by the fan will pass through the zeolite sieves, the molecular sieves that my colleague Talas had shown in the previous slide. So at the same time, increasing the flow rate of the air from ranging between 20 liters per minute up to 60 liters per minute of air. So we will also have the solenoid valve, which is in the middle here, that will actually, if we have a lot of air in a chamber, it will tell us, it will be the one that will close automatically using the electronic circuit that the air should flow or not. Then we have the first flow sensor. This one is the one that will sense the flow that the fan is actually propelling inside the system for air filter or rather air absorption, for nitrogen absorption to have a higher percentage of oxygen. Then comes the second flow. This one is the one that the flow sensor that will be at the delivering end to the patient. We have to know how much air are we delivering, how much oxygen are we delivering to the patient. So the second flow meter will be, the flow sensor will be on the delivering part to the patient. Just after you blend the right amount of air and ambient air and oxygen to have a percentage that will deliver to the patient that is quite efficient. And we have three pressure sensors: pressure sensor 1, pressure sensor 2, and pressure sensor 3. So each pressure sensor has its location. The first pressure sensor is at the intake before the purification of the air. We need right amount of pressures as much as we need the right amount of flowing air. And the second one, it's just after the purification at the chamber that will have some oxygen kept. So we have to know how much pressure are we handling. If the pressure is much, we end up bursting the pipes. So that's the use of the second pressure. And the second pressure is to the delivering tubes to the patient, to be able to know how much pressure are we delivering exactly to the patient, not how much pressure we had on the intake, but how much are we delivering to the patient. Because if we end up delivering so much pressure to the patient, will cause a condition called barotrauma, and the person suffering from something else, lack of oxygen or COVID, will end up dying from barotrauma, not the immediate disease. So we want to cure the person, not to cause another problem. So we need all these measurements. And if you can get to see at my far left, we have ultrasonic atomizer. So the ultrasonic atomizer, it's a humidifier. When put on a surrounding, it atomizes, it excites the particles of the elements which are there. So once we put it in water, it excites the particles of the water and evaporates them without heating them at the same temperature. They just get to evaporate. So because the high flow water cannula, we need a good amount of humidity. So this one will control the humidity. We'll get to evaporate the water to give us quite a good humidity. And again, apart from humidity, we also need warm air. So that is done by a relay, which is here close to the fan between the Arduino microcontroller and the fan. So the relay will control the heater that will get to heat the tubes to give us a good oxygen warmth that will deliver to the patient. Since if we happen to deliver cold oxygen to the patient, we shrink the trachea and the lungs will get to shrink and the person will have the work to warm up the air by themselves. So we want to reduce the work by the patient to warm up the air that they inhale and to give them comfort. So close to the ultrasonic atomizer, we have a pulse oximeter. I've already stated the pulse oximeter is there to actually measure how much oxygen is in the blood of the person, not the oxygen that is in the air or in the system, no, in the blood of the person. That's what will help us to see how much are we going to deliver to the patient, how much are we going, how much flow or how much oxygen, how long the duration we're going to deliver the oxygen. So that will help us to control that, and that will be handed to the patient. And if you can see closely at the far left where there's the microcontroller, we have a 12 volts power supply, though not included in the sketch, but the wires goes to the solar panels, which we had shown in the hardware component of the previous slide. So this is a 12 volt battery, 24 amp hour, which probably would run over 12 hours of night. It's over, but we, mostly on worst case scenario, would run 12 hours without a problem during night, and during, probably during day, you will get to use the sunlight directly, and some maybe if there's no sunlight, the power left in the batteries. So this software, this electronic circuit to work, it needs a firmware, which we have written. So it's in the next slide. So next slide, please. Yeah, so the firmware is big, probably 700 to 1,000 lines of code, excluding comments. So that is one that is controlling. This is just an overview of the Arduino code. It's in C++. The firmware, that is the underlying part of the electronic circuits that we have designed, that is in the previous slide. So this will be able to control all the parameters, the fan, the relay modules, the solenoid valves, including the pressure sensors, to be able to make the system synchronize very well, that we don't kill the patient, but we give the patient the right amounts at the right time, considering the factors that we don't need to cause other problems like barotrauma. So that's the part that I had to take you with. So I hand over to my other colleague to the next slide.
Guys, I apologize for being rude, but consider that you have 6 minute presentation.
6 minute presentation.
Okay?
Okay?
Yes, yes.
Yeah.
So Terence.
Okay. Thank you, Mohammed. I'll take you through the rest of the slide. So basically, our system, our device is a class 3 device, which we anticipate to be of the size 550 by 375 by 440 millimeters, weighing approximately 6 kilograms. The estimated lifetime of the equipment in use, we have put it at 8 years with a 5-year shelf life. Next slide, please. So our device will be manufactured and we plan to have it compliant to at least a minimum of 4 ISO standards, basically being the ISO 18562 of 2017, the part 1, which deals with the evaluation and testing of the risk management process, targeting the biocompatibility of the breathing gas pathways, as well as the ISO 20789 of 2018, which focuses on the passive humidifier for anesthetic and respiratory equipment, as well as the ISO 17510 of 2015, the medical device standard, which focuses on the sleep apnea breathing therapy, as well as this mask and application accessories. And then on the electrical components, we would like them to be compliant to the first part of IEC 6061 of 2015, which deals with the general requirements for safety of medical electrical equipment. On the implementation, especially on the operation side, we also expect the administrators of, or the users of this particular device, which will be the medical personnel, to be trained in line with the operation as well as the maintenance of this device. So our training will entail a short video and then a procedure, procedure manual, which is going to be designed to guide in the use of this particular device, as well as the feedback in its use. The impact of the use of this particular device, we expect to reduce the number of countries with shortage of oxygen, as we're going to make use of the available atmospheric air, as well as improve the health and safety conditions of the health workers and patients, as well as improve the treatment conditions for patients in low resource settings, especially the rural areas where we've got a scarcity in terms of resources, and ultimately reduce the number of deaths caused by oxygen deprivation illnesses. This system is going to provide a system that would function for all health groups across from the children all the way to the adults. Next slide. Thank you. I'll hand over to my leader, Mohammed.
Thank you very much for that, Terence. So please, would like to accommodate any questions here?
I have a question, please.
Yes.
Apologize, but just a quick question with a quick reply. We are out of time in an important way.
That was a very beautiful presentation. Can I ask my question now?
Sorry, we can't hear you.
I said that was a very beautiful presentation. Okay, let me ask my question quickly. My question is, since the device is going to be powered by solar, have you designed your device in such a way that it can store power for some time until the power from the solar generator is restored?
Sorry, we can't hear you.
We can't
understand me.
To type the question.
Can you type your question, please?
Okay, I'll type it now.
In the meantime, that the question is typed in the chat, I'm inviting all the mentors to check their mail. They received a link for voting directly online. And I invite all the audience to start for this project. In the meantime, people from Group 2 can reply to the question.
Okay, so yeah, the question says, what happens if the generator runs out of power? So yes, in the presentation we said our device is compliant with a solar-powered generator, quite all right. But there is also a battery, a rechargeable battery in the device that stores up power just in case we have issues like that, and the power should last about 20 hours.
Thank you guys for the response. Let people vote. We are a very important number of participants. I see that there is also the next speaker from EngineeringForChange. I kindly ask her if she can, if it is not rush, we can complete the first lot of presentation. And I'm kindly inviting all the next presenter to be on time. because this can keep the audience fresh and allow you to receive a very good vote at the end. We know and we will evaluate the technical aspects, also looking at your documentation. So you don't need to explain dot by dot and wire by wire what you did.
The votes, where exactly are we voting?
Sorry, David?
You said you have sent a link for the voting.
Yes, check your email.
Oh, my email. Okay, thank you.
You're welcome. Okay, I'm going to stop the voting in 3, 2, 1, 0. So thanks again, people from Group 2, and thanks again to your mentors. I know that you worked a lot, and now I'm inviting people from Group 2 to give the presentation.
Okay, hi, this is Bessel from Group 3.
Okay,
am I allowed to share my screen?
Of course.
Okay, great. All right, Shannon, we could start now.
Sure, sorry, I just can't see your screen, but that's all right. I'll use the PowerPoint.
I can see the screen, so.
I might just have poor connection. I do apologize for that. Good afternoon, everybody. I hope you're all doing well. We are Group 3, and we were tasked with looking at an innovative way to improve contact tracing and isolation. Our team comes from all over the world. We're very diverse in terms of where we come from and also in terms of where our backgrounds lie. So we are looking at contact tracing, and we have a clinical need where COVID-19 is the problem. COVID-19 spreads easily. It spreads through respiratory droplets predominantly. There's no cure, there's no vaccination, and contact tracing is the key way to limit the spread, as much as a key way to limit the spread of COVID-19. Contact tracing uses trained individuals to identify people that have come into contact with infected individuals. Contact tracers then contact the exposed individual and advise them on the next steps they should take. Contact tracers should ideally be able to monitor exposed individuals to see if they develop symptoms. So that involves contacting them every day to see if they've developed symptoms. The problem with contact tracing is that it requires a complete and accurate record. You have to know exactly who's come into contact with an infected individual when and how long they were in contact with that person for. It's time and labor intensive. It requires trained individuals to actually contact trace, and it infringes on personal privacy because it relies on using personal information about someone in order to actually trace them. And it's unsustainable because it is so intensive in terms of labor and time. So contact tracing is the key way to handle COVID-19 and its spread at the moment. And so there have been a few solutions developed, such as the smartphone apps, such as Trace Together, which operates via Bluetooth, but it requires both phones to have the app, and it allows data of the infected person to be shared with the government. There's also Estimote, which is a wearable device that produces short-ranged wireless signals. It's made for the workplace predominantly, and if an employee develops symptoms, they press a button to notify other exposed employees that they are now at risk. The limitation of these devices is that they often infringe on personal privacy. They have implementation limitations because a lot of government organizations won't allow them to be implemented, and they also are not cost effective and can't be implemented in all contextually, in all diverse contexts. Thank you. On to my teammate Stanley.
Okay. Hello everyone. My name is Stanley. I'm from Nigeria. So why Tracy? So based on the already existing solutions of contact tracing, we are able to find a loophole so that we'll be able to design a device that can actually use a technology that can track people even without a Bluetooth or even without a mobile phone. Can you hear me?
Yes, we can hear you, sir.
Okay, great.
Hey,
So,
you can hear you.
okay. So for the device, we came up with a new method that is innovative and doesn't require the person to have a mobile phone. So what Tracy does is Tracy combines both a technology of digital thermometer and also QR code scanner. So now, why are we using a QR code scanner? Because of every individual will be recorded, would have their information recorded in a QR code, would be recorded in a QR code, and that information will be scanned before the individual enters into a public space. Now, what makes Tracy innovative is that Tracy scans the code and thereby records the information of who and when they entered a given public space. And also it reads the temperature in order to detect people with high temperature so that they can be isolated as well. And also, what makes Tracy very unique and innovative, it uses an accurate method and also completes records of people that comes in contact with the device. And also Tracy counts and helps to isolate and more complete accurate record of people and the duration of time they went in. In conclusion, Tracy is here to trace for you. Next. Now, our intended users, we already know that Tracy is portable, adaptable, reliable, and cost-effective. But Tracy can be used in a wide range of public places and also such as shopping centers, schools, hospitals, and even places with high traffic that might be also transport stations. And Tracy users are public business owners, consumers, and managers, but most especially are the government health authorities who receive data on who entered the stores and when, and for how long were they in a given space or in a public space. Next. So classification and standards, we chosen class is class 1 and standards, no specific iOS standards to follow from the questionnaire and only general standards applicable. So which means that Tracy is adaptable in any situation. Thank you to my teammate Basil.
All right, so now we're going to have a quick look on how did we come to this solution exactly. In our device, we have several components. Each component we have multiple options. So we did a morphological box to vote on which component are we going to use. The criteria we consider are the cost, the reliability of the device, the variability. Is it applicable in African countries? And in that way, we kind of came into, one could say, the optimal solution. So, okay, so how exactly do Tracy operate? So first of all, the QR code stickers, the user have them. The user here, let's say the public. So then individuals scan the QR codes, which then the information is uploaded to the database, the information which is the number phone and the name, which is optional, and also the time of checking into the place. Afterwards, the individual have his temperature checked, which is displayed on a screen, on the screen that you can see right here. If the temperature is above 38 Celsius degree, for example, the individual is not allowed, the red light bulb is on, and the individual is not allowed. He's asked to wait for a time interval so that the environmental effects are eliminated, like the weather. And then after the person enters the space, let's say the supermarket, for example, after he finishes his shopping, and was in his exit, he scanned his QR code again. So that way we know who was in the supermarket and at which time interval. So it becomes much easier for the contact tracers to communicate with the endangered people. So what is the impact of the device? Like, how is it going to improve the case of African countries regarding the COVID-19? So first of all, and most importantly, is the tracing. We're able to trace down the endangered individuals, warn them that they are possibly infected, and advise them to be isolated and or checked. Counting, which help us in the social distancing in the public places. Prevention, which is also related to counting, and it's done by social distancing. So there is a limit for people in every place according to its area. And detection. Of course, detection isn't much accurate, but it is it's efficient enough. So yeah, that's it. So we'd like to thank everyone for this huge opportunity. Our team is glad to have participated in this bootcamp, and now we're glad to receive any questions.
Thanks again, and congratulations for your presentation. Congratulations to your mentors too. There is a question you can read directly in the chat. It's asking about the storage capacity of this application. Tracy.
In terms of number, we're not actually sure about it, but it's not supposed to be like very high, because it only stores like the number of the phone number of person and the time of checking in, and also this data is uploaded directly into a server that the contact tracers have access to each day.
Okay.
Good afternoon.
Yeah.
I have a question for you,
Guys, I'm really happy for this request to have question, but just this has to be the last one. Otherwise, we're going to be very, very long. Okay, just a quick question with a quick reply, please.
All right. So I want to ask about how Tracy is planning to be detecting COVID-19. Because if we look at it, having high temperature alone doesn't justify that you are going to be positive for COVID-19. And I only see a temperature sensor there. And what do you plan on doing to reduce tension? Because if you start sending messages or start informing the COVID-19 response team in the locality of someone's high temperature, how do you intend to reduce tension? Because a lot of people have malaria, which is not something we should be mixing up with COVID-19. That's my question. Thank you.
Basil, can I answer that? Okay.
For the sake of the time of the session, I think we should answer it in the chat room.
No, in the meantime, I'll let the polling start so people can start to evaluate the project of group 3. In the meantime, you can start. You have 1 minute since now. Go. One of the most beautiful things of online events is that I can see how the bars of votation are moving, and at the same time I have like the panel of evaluation of your mentors. So it's nice to see that I don't have to collect at the end. So
I'm not sure if the question is being responded to in the chat room, but the point of Tracy is not to be a detection device. The point of Tracy is to help contact tracers. So the point of Tracy is to help improve the record and to make the record more accurate, so that when contact tracers are notified that someone has been infected, they can then use Tracy to help supplement their efforts to then go back and trace and see who's come into contact with who, when, and for how long.
think this reply to the question. So we are going to stop in 5 seconds. 4, 3, 2, 1, stop. So let's have a short break, a few minutes, I mean, just to relax. Then we will ask to Jana to introduce the activities of Engineering for Change, and then we will restart with the presentation, asking to the presenters to keep the time. That is important. So see you in 3 minutes, no more than that. Go to the restroom and come back.
So, in the process, well, we all have our crosses to bear. So we're going to start with the laughers.
Back. One second. So Jana, I apologize, just to if we can make a quick switch, if Tinihiko is present, because I received their message now. Is for Nico.
Do you say I need to leave? Do I need to leave the meeting?
No, absolutely not. So I received well, Mr. Dan Dutois, if I'm reading well, is going to leave, if I'm right.
Carmelo, this is Dinyiko from the DSI. Mr. Dutoit is available.
Okay, if Yana, you don't
But
mind.
if you'd like him to wait, he can also wait. It's really up to you.
No, it's up to him and Yana, because it was supposed to have the closing remark and also to introduce the price at the end. So it is important to have his speech. If he is available later, it's a pleasure for me for having him.
Yes, Carmelo, he will be available later. Thank you.
Perfect. So Yana, we can keep the standard schedule.
All right, thank you so much, Carmelo. I will try to keep it brief as possible. I know that you are all eager to move ahead. So good afternoon, good morning, good evening, depending where you are this day. I'm so thrilled to join you. My name is Yana Aranda, and I am the Director of Engineering Global Development at the American Society of Mechanical Engineers. For those of you who may not be familiar with ASME, ASME is a not-for-profit membership organization for enabling collaboration, knowledge sharing, and skills development across all engineering disciplines, reaching over 100,000 members in over 140 countries. Our goal, our mission is to really serve diverse communities by advancing, disseminating, and applying engineering knowledge for improving the quality of life. And that's really critical given what you all are working on here for the past 2 weeks. So I want to talk a little bit about what is motivating our work, in particular in the Engineering Global Development Group. As you're all familiar, globally, there is still a very tangible lack of basic services, critical infrastructure, and essential technology. We know the really heartbreaking statistics of global deaths and lack of access to things like sanitation to 40% of the global population, 29% of the global population lacking safely managed drinking water supplies, and as of today, over 490,000 COVID-19 related global deaths. So there's a tremendous need for technical talent and technical solutions to be able to address these challenges. And these challenges are encompassed in the United Nations Sustainable Development Goals, the 17 bold goals that you are all quite familiar with, given your participation. For us and from our perspective, it is essential to have technical talent that is prepared to engage effectively in addressing these global challenges today and in the future. So with that, Engineering Global Development was launched at ASME. Our group seeks to achieve a world where everyone has safe water, sanitation, energy, food, shelter, information infrastructure, and can live in health, dignity, and prosperity. Our work is entirely focused on building this pipeline and capacity of technical talent to really solve these urgent challenges and deliver sustainable solutions. We have a pipeline, 3 key pillars that we focus on to deliver this: knowledge and community training and our various platforms. Our knowledge as a public good platform and community is Engineering for Change, and Engineering for Change has been an active supporter of the bootcamp. For those of you who might not know about us, Engineering for Change is a digital community and platform of over 1 million engineers, technologists, social scientists, and development practitioners, all working to advance quality of life. As part of E4C, we invite you to explore our growing database of over 900 essential technologies, including many health devices that you can leverage to improve quality of life in communities around the world, as well as access research studies and field insights. learn about the latest developments, best practices and opportunities and expert perspectives as part of our webinars, courses, seminars, and beyond, and contribute your expertise, insights, and ideas on our digital platform and our social media communities. Everything is free. You can become a member at any time, and we really do welcome you to join us. In addition to the digital platform, we have a variety of programs, including our E4C fellowship, where we train future practitioners in this sector. We have an annual fellowship with predominantly early career engineers and technologists, architects, scientists under the age of 30 who conduct ecosystem research, investigate insights from the field, and deliver research results for publication online and distributed to partners and presented at conferences. Two of our fellows supported the bootcamp this year, Carolina Rojas and Nishant Agarwal, and we had a number of fellows also author background papers that were used as reference material for this event, as well as the Economic Commission for Africa Investment and Impact Forum. So I really do encourage you, if you are interested, to apply for the fellowship. Our fellowship this year, we have our summer cohort of 25 fellows from every major continent. Over 56% of them are women, and we are hoping to have a winter cohort as well. And hopefully we can reach out to some of you and invite you to join us as part of that cohort. In addition to this, I'm thrilled to share with you that as part of our portfolio, we also train social entrepreneurs and host our innovation showcase annually. We are just wrapping up actually today our US event. So we annually have events in the United States, Kenya, and India, where we select 8 finalists from around the globe for each event to join us and receive design and engineering review support with our community of experts. 3 winners are selected at each location to receive $10,000 US, as well as due diligence and capacity building, design services, access to experts and peers, and also promotion and awareness building. We focus specifically with iShow on hardware-led social innovation. So after this bootcamp, if you pursue your ideas and develop hardware, we welcome you warmly to join us at our competition at this accelerator and receive additional support and connections. And with that, I just want to say that it's been such an honor to support this bootcamp. This is one of the ways that we engage with a variety of platforms as part of our portfolio. We want to continue to work with University of Pisa and the other partners and support UBORA as a platform to really drive innovation through education. So I'm going to, I hope that wasn't too long, Carmelo, because I'm really excited to have the honor to announce the best photo from the competitors. And congratulations to Obed Imbahapi. I don't know if I'm pronouncing your last name correctly. I do apologize if I am not. We believe this particular photo and illustration, it really embodied the spirit of the bootcamp, and we want to congratulate you on this acknowledgement. I'm not sure if, Obed, if you're on the line, if you want to say a few words.
I'm pretty sure because he's one of the most active people in the group. Oh, actually, he's not here, but we will find him immediately.
Of course. Well, congratulations, and congratulations to all of you for participation in the bootcamp. Your contributions, your ideas, your innovation, and your collaboration with your teammates is so incredibly important in driving new innovations in this space and beyond. So again, I want to thank you for the opportunity to say a few words. I want to invite you to join us as Engineering for Change members. We have one of our sectors is health, and we are eager to invite you to contribute and engage with our community. Thank you, everyone. My email is available here. If you have any questions, do feel free to ask. I know there's not a lot of time. Happy to address any of these questions also in our chat window. And my colleague, Mariela Machado, is also available here. So do feel free to reach out. Thank you.
Thank you, Yana. And I see that the link for EngineeringForChange are shared by Mariela. So I'm invite students to contact you directly by email by looking at the contact. So hi, Mariela. See you now in the small box. Nice to see you again.
The same.
So, I hope so. We have to find the students who won. In the meantime, we can proceed with the presentation of the students. So let's talk people from group 4. People? Group
Yes,
4?
sir. We're here.
Perfect. So
I'm just going to share my screen, okay?
You can share the screen, you can go.
All right. Okay, so whenever you're ready, sir.
Put in full screen mode and then, okay.
Good. Can you see it? Okay. Right. So good afternoon, ladies and gentlemen. My name is Yusuf Al-Sheikh, and today my team and I will be presenting to you our project, the automated hand washing sanitizing system. So here's what we'll cover in this presentation, but mainly you should know that we will focus on the conceptual design and the impact of our device. First off, a quick recap. The medical needs which we wanted to tackle are that the devices, the general devices for hand washing, actually are not applicable for all users. Some of them might have disabilities and find it difficult to wash their hands. Moreover, we also found out that the tap, which is used to control the flow of water, is touched hundreds of times, and that 80% of common infections are actually transmitted by hand. We were shocked also to find out that 4 out of 5 people do not wash their hands after using the bathroom. So this kind of raises the awareness, which tells you, be careful when you shake your hands with someone. And lastly, we also found out that this is maybe because it's scarce and the availability of finding washing facilities outdoors is quite difficult. Moreover, we wanted to create this device to be targeted for people with all disciplines and backgrounds. You're not supposed to be special to you to be able to wash your hands. So this device is also integrated in establishments such as hospitals, schools, offices, and etc. We found out that you don't need exceptional knowledge on how the device operates. You just need some common sense. And of course, we'll provide you with a label to clarify on how it operates. And this device mainly increases the awareness on a personal level because it appeals to all ages and mindsets through its easily friendly interface. However, for details, I would like to introduce Mr. Mack, who will go on with the details of the design itself.
Yeah, thank you very much. I am Mohamed Kamara from Sierra Leone, West Africa. So our system is a full independent system that does not require any touch or use of hands. All you need is to just place your hand, and of course, soap, water, and sanitizer will dispense one after the other. It's the most appropriate option to prevent the spread of infectious diseases. And at the moment, we are all familiar with the COVID-19, which is transmitted through touching surfaces. Our system is an automated system that works without any use of hands, but it just automatically placed in your hands. It also comes along with a backup system that has a manual foot operated system. All you need is to use your foot and step on it, and you are fine to go. Yes, please.
Yeah, good afternoon. Yeah, I'm going into detailed concept of our design now. I'm Victor from Nigeria. Can everyone hear me?
Yes.
Yes.
Yes, we can hear you.
Yeah, this device is fully sensor controlled. The user does not need to touch any surface at all. This sensing concept is more of physics, but we'll not be going deep into its analysis. But for the good of everyone, just to have an idea, I'm going to explain what it's actually all about. Every object or black body radiates heat and processes ultrasonic waves. This sensitizes the ultrasonic sensors and infrared sensors when we put our hands under these sensors, and these sensors are located at the tap. The signal is received and sent to the actuator. Now we are using solenoid valves here by means of a controlling unit known as the microcontroller. This solenoid valves helps to control the movement of water to and fro the two different 55 gallons barrels of water. Now, another aspect of this design which we are employing is the water level sensing. We're going to be using two water level sensors. One is used to sound alerts when the clean water in the storage tank is almost exhausted. It gives different signals with different colors. Green can indicate when the water is, very full. Yellow when it's almost exhausted, around 50%, and red light when it's below 30%. So the red light indicator can start blinking, steadily at around a 25% volume of water remaining. Another water level sensor will be used in the wastewater tank to automatically discharge wastewater before overflow, thereby reducing the risk of infection and manual waste discharge. Now, also, we have a manual backup system, as Mr. Mark has said. It helps in reducing risk too. It helps when the battery of the device runs low and there's limited supply of electricity for a recharge. So this manual backup system also helps to eliminate body contact because it uses just full foot pedals. Next slide, please. Now we have ISO standards, International Organization for Standardization, and we have made sure we duly followed all the standards. These standards covers the product life cycle of the device, the widespread risk management, the human factor management, the symbols and labelings for easy use, the clinical performance, the software requirements, and the electromedical devices requirements. Thank you very much.
Right, so before we go on, I would like to go back to this previous slide, sorry. Okay, right, the conceptual design, we talked about it. Okay, sorry about that. On with analyzing the stakeholders with Mr. Clifford.
Okay. Good evening or good afternoon.
Good afternoon.
I'm from Kenya, Dada Clifford from Kenya. I'm taking you through the people who are of essence of utmost importance to our products. We'll first talk about the consumers. These are the people who are going to use our product, and it involves the general public in both the private and public institutions, the banks, hospitals, schools, malls, and our producers where we'll be getting the supplies to make our product will be the neighborhood shops and hardwares, electronic shops, water supply companies, and the supermarket to get utilities like the soaps. Our partners involves the local and national governments, the university, they can help us to do the research, and the UBORA community. The owners of this product will be us, the team members, and the communities. The communities can be the people who are using it, our consumers, our donors, and the people putting it, helping us to advertise it and spreading the word about it. Thank you.
Yes, next slide, please. Yes, Mohammed again. So the cost structure and the sustainability plan for our project includes, we want to be doing regular maintenance and check on the automatic systems. That we'll do, of course, with communities. We'll empower other young people by teaching them how to actually run maintenance. And of course, we will empower these people to do the regular maintenance on the system, because by that we'll create jobs for them and of course empower them to become agents of change. We will also establish partnership with supplying companies, like companies that can do clean water supply for communities, community organizations that also do sanitizer manufacturing, and as well as soap. To make sure that our cost serves the ordinary African, our cost range from $40 upwards, depending on the size and the content of what you have, because we find out that the average African live on $1.25 a day. So providing a system with just $40 that solves not just the COVID-19 transmission, but all other systems and transmission diseases. Our system has a lifelong lasting of 5 years. All you need is one-time purchase of our system, and you can use it more than 5 years. Yes. So it also has a life shell of 3 years. So this is all what we have here, and let's move to the next slide.
Okay, good day everyone. This is Dara from Nigeria, a member of Group 4. So to conclude this presentation, I'll be talking about the impact that this project will be making on our global community. First off, it increases the awareness. First off, it will reduce the spread of infectious disease, and for this case, COVID-19. As recommended by WHO, washing of hands along with social distancing are the only effective methods for tackling this virus. So a project like this will no doubt be the most needed at this time. It also helps to increase awareness of personal hygiene. It helps to resensitize the community about the need for good personal hygiene, which cannot be overlooked for a sustainable good health. And this project is also built on the fact that the financial conditions around us, because we also want to consider the affordability of this project. And finally, it is just what we need for Africa to move to the next level of technology, to the new industrial era of robots and artificial intelligence. And also, let's not forget how many job opportunities that this will create when we consider mass production and repairs of these automated systems. Thank you.
Right. Thank you, everyone. But first off, before we sign off, this is the ideal which our team. So we know that currently for COVID-19, there isn't a specific vaccine. However, we said that infection prevention is as important as finding a vaccine itself. So we're pleased to tell you to please wash your hands and protect yourself, and let us aid you with this. We created a small label for you to show how our device is used, and you can check it all out in the documentation on our device on the UBORA platform. So this is us, and this is our mentor Lewis. Some other mentors were not able to be here today, but however, this team is so grateful to be a part of this amazing experience and to be a part of this amazing cause. So please wash your hands, and we will be more than happy to answer all your questions at the moment.
For being enough fast and let the audience understand. I think that there is one question. We have space for one question.
Yeah, any question, please?
There is one question about accessibility, so please do the question and then we can move.
I'm Shannon from Group 3. I have a question about accessibility. You mentioned that everyone should be able to wash their hands. You shouldn't be special to be able to wash your hands, implying that this should be a fully accessible device. And yet, unless I've missed something, and yet your device hinges on you being able to lift your arms up to the device, and if the sensors aren't working, on using the foot pedal to be able to actually manually pump the water or the sanitizer down and the soap. So my question is, for people who have disabilities, a myriad of disabilities, be it visual impairment or a physical disability, they can't use your device then, unless they're assisted by someone else, which it contravenes, social distancing.
Right, I do agree with your point. I see what your point is, but the thing is, you don't have to, maybe just because you put anything under the sensor and it will just trigger the process itself, right? So we weren't focusing on that part, but we were
And
just
also,
yes, go on, Washington.
For an idea for visually impaired people and other people with disability. So we could say as we go on forward, we might also consider putting on voice, like a speech, which would be able to tell the users what to do exactly and when to do it. So basically the thing is, for this device, we're trying to capture a certain market where we wanted to make it affordable. So that is why we wanted to make sure it was simple and sophisticated at the same time.
Well, first of all, I want to thank Shannon for her question because it's quite, it brings up a couple of things that we need to improve on our device. So
I saw there's a question that says some of rural areas have no power. So the device, there is a question that says some rural areas have no power. So the device uses its own independent power source, which is the battery, and it has another function.
That's
so
true.
for charging the battery, you can either use a solar power or electrical power. So in the rural areas, you may have to implement the use of solar power.
Okay. So thank you again. I'm launching the poll. One second, then you have 1 minute more.
Please, can I ask a question, please?
Thank you.
Can I ask a question?
Okay, please go on.
You were speaking about costs. So we know the average in like example in Nigeria, the average cost of living is less than $1.
Okay.
Per day is less than $1.
Okay.
So how do you solve this problem for people living in rural areas? How do you solve this problem? And again, in terms of electricity, because I know involving solar panels is quite expensive.
Yeah. All right. So communities can actually, come together, and at least for a compound of about 10 people, they should be able to afford a $40 equipment. So concerning the area of no electricity, we have batteries that store DC power, so that in case there's irregular supply of electricity, you can charge and also use. For a completely blackout society, that is why we have the mechanical backup system to use. So just using the foot pedal. So those who can afford the system to be based on solar provision of electricity, as you said, the cost is based on what you can afford. It's based on affordability. So for areas that need a good recycling of energy, if you want us to implement solar energy, it doesn't require much expense, because we just need just one panel for it. So that's just basically concerning cost. So I'm sorry, please, the lady.
Guys, 1 second,
Okay.
I'm going to close the poll.
Okay.
So, I'm inviting you to reply also later by email to the questions. I have to keep the time, otherwise we're going very long. If you know each other, you have the email, you can use the chat, but we have to move on. I don't want to, I have to be unpolite. I'm sorry about that. Okay, so Clifford is also saying that everything is documented on UBORA. You can go and check, and this is how we can proceed. So checking the documentation and trying to provide useful question. So I'm asking people from group 5 to be to present their work, and just a quick suggestion for if you are not speaking, please mute your microphone. Also, if you are of the same group, because this will improve a lot the quality of the audio. The screen with personal messages. Okay, you can go. Should be any problem? Try to reshare the screen again.
Yes, I'm trying to reshare the screen.
Okay, take your time.
Okay, that's good. Is it showing?
Yes.
Okay.
Hello, everyone. Can you hear me?
Yes.
Yes.
Okay. Good day, everyone. My name is Sheyi, and I'll be presenting with my partner, Linet. We both will be representing Group 5 in today's presentation. And our project is based on the development of a new testing method for COVID-19. And our project name is titled COVID-19 Rapid Test Pro. Introduction. We understand that COVID-19 is a global pandemic caused by SARS-CoV-2, and it has caused major challenges in healthcare system due to the way it's been spreading across the globe. And next slide, please. Next slide, please. Okay, the number of people tested is way below the total population, especially in developing countries. This makes detection done lately, especially when aged or individuals with underlying medical condition are involved. So the main challenges is to detect early in order to contain the infection at an early stage. Next slide, please. The current available testing method is the PCR, which is the gold standard method of testing because it accurately detects the presence of viral genome, and it uses the RT-PCR technique, which is the reverse transcription polymerase chain reaction technique. Next slide, please. And we also have the antibody testing. This detects the presence of antibodies in the blood of an infected individual, that is the IgM and IgG. Next slide, please. So we have some challenges with the current method. In terms of the PCR, we know that the PCR, it's kind of very expensive, and it's slow in terms of it takes 2 to 3 days to be completed, and it's kind of complex. It requires an expert to carry out the machinery, to operate the machinery. And in terms of the antibody, we know that it is invasive in the sense that it requires you to get blood from the patient. And we also know that it is unreliable in the sense that it only detects if the person has been previously exposed to the virus. It does not detect current infection. Next slide, please. Mobile. So our project is meant to address the previous challenges that I highlighted in terms of affordability, accuracy, accessibility, the speed of detection, the risks of exposure, and user friendliness. On this note, I'll call on my other partner to carry out for me. Thank you. Linet, are you there?
Yes, I'm here. I hope everyone can hear me.
Yes, we can hear you.
Yes, we can hear you.
Thank you. So for we created COVID-19 Rapid Test Pro, which is a CRISPR-based immunochromatography assay method. Sorry, can I request those who have unmuted mics to mute them to avoid the noise in the background?
The person with the muted microphone is one of your teammates. I don't know who is. It's named admin. Okay.
That's she. Please can you mute your mic? Thank you.
Okay, so for our project, we created the COVID-19 Rapid Test Pro, which is a CRISPR-based immunochromatography assay method using the CRISPR technique to detect the presence of SARS-CoV-2 viral RNA. So I'm not going to go into much detail about the CRISPR technique itself, but it is basically adapted from bacteria immune defense system. And for our project, it works very similarly to a pregnancy test or a rapid antibody test, but instead of antibodies, we use CRISPR technology, which is more specifically a vaccine system. For this project, we decided to stick with the use of saliva sample for the detection of the of the virus, because saliva is more preferable to blood as it is non-invasive and user-friendly. It is easy also to obtain a large amount of saliva sample as compared to that of blood without causing any discomfort. And it has also been proven in studies that saliva can contain the right amount of COVID-19 genome that is adequate enough for testing and diagnosis. And the US FDA have approved the test to be conducted on saliva samples on patients. This also just decreases the risk of those healthcare workers who are performing the test on them getting infected or them infecting the patient as well. So for our concept design, the test kit itself, it consists of two main components. The first one being a double compartment collecting tube for the collection and processing of saliva sample. And I'll go much into detail when I get to the methodology on everything that is in the tube and how it works. And then the second compartment is a lateral flow dipstick that is dipped into the saliva sample to obtain the result. I'll also go into detail with that when we get to deal with the methodology. So basically, this is our design for the collecting tube. It has a double compartment divided by a valve for the two processes involved in breaking down the RNA, the viral RNA, and allowing the CRISPR-Cas13 complex to bind to the viral RNA. So as you can see on the image, it has the first compartment divided by a valve, and usually when the patient is spitting into the saliva, it has to go up to the level of the green marking. I hope you can see it clearly, but I'll go into detail with it as we go forward. And this is the lateral flow dipstick, which consists of 4 different segments. Main important ones to note is the conjugate release pad, which contains nanoparticles and reporter molecules, and also the nitrocellulose membrane containing the test and the control site. So for the procedure of the test, the first step is for the person who's the user to spit into the tube and into the primary compartment of the tube, where the saliva is deactivated and broken down by the GITC denaturing proteins. This protein specifically targets the viral RNA, and after that the tube is placed in warm water. This plays as a catalyst, basically to speed up the process of the clearing of the RNA and to expose the viral RNA. And then after 30 minutes of being placed in warm water, the saliva is released into the second compartment, where the specific CRISPR-Cas13 enzyme bind to the now exposed viral RNA. And this is left at room temperature for about 6 to 10 minutes. And then afterwards, the test strip is then dipped into the sample, where the fluid travels from the sample pad to the absorbent pad. This is from left to right on the diagram. The present nanoparticles attached to the COVID-19 viral RNA bound to the CRISPR-Cas13 complex if they are present, that is, if the person is positive. And at the control site, there is anti-CRISPR-Cas13 antibodies to produce a control reading. So this is basically where you dip the test strip into the tube. And 2 lines are visible to produce a positive reading. A line only at the control site is a negative, and no line at the control site is rendered invalid. So this is basically the summary of the whole methodology, from spitting into the test tube and allowing the process to occur until you take your reading for the result. And this is the model of our tube, and this is also our test strip in PVC cover. So in conclusion, I would like to just say this proposed solution can increase the testing rate and diagnosis in low resource setting. This methodology can prove to be effective in combating the main challenges we are facing with the spread of coronavirus, and it can also allow for interventions to take place prior for the development of severe symptoms, especially for those patients who are immunocompromised and those who have underlying medical conditions. And beyond COVID-19, this testing method can be modified to detect other viral infections. And these are all the group members and our mentors. Thank you so much, everyone who was involved in our project. Thank you. Take questions if there is any, and I'll allow my group members to also intervene if there's any questions that they would like to respond to.
Thank you very much for your presentation. It's like a completely new type of device with respect to the other that were presented. There is one question that I'm inviting you to reply. In the meantime, I'll start the polling. So the question asks, how can your device differentiate between COVID-19 and other viruses?
Okay, so
hello.
Okay, you can answer.
You can go on.
So what I was saying is just that I didn't go into specific details with the
You can go.
Miss
Lynette, are you there?
The process, the principle involved in the working principle of CRISPR technology it's a kind of genetically engineered product that binds specifically to COVID-19. In other words, it does not bind to other viruses that might be.
Hello.
So it binds specifically to an engineered product that binds. Can you hear me?
Yes. Sorry, I don't know. I think it's my network. But you
Yeah,
answer.
you can hear you. You can hear Victor and Shay.
In the meantime,
So
the has started. So I'm inviting Lynette to provide the answer to the question. Otherwise, please indicate which person of reply. And I'm going to mute all the other people because it's impossible to understand. So Lynette, please provide the reply or indicate who is going to reply.
Okay, I'll provide with the response. So the CRISP technique, it's genetically it involves genetic modification, which means that it can be engineered to specifically identify a specific virus for that which we'll be testing for. In this case, if we are testing for COVID, it will bind specifically to the SARS-CoV virus and not to any other that's present.
Thank you for your reply. I'm going to end the poll in 5 seconds. 4, 3, 2, 1. Poll is closed. Thank you very much for your presentation. There is another question that I'm inviting you to reply directly by chatting. I'm inviting instead people from group number 6, from team number 6 actually, to present their work. Who is going to present from group number 6?
Hi, Dr. Carmelo. Yeah, I'm going to share my screen now.
Okay, perfect. Ala, right?
Yes. Can you see the screen?
Yes.
Okay.
Okay. Hello?
Yeah, the judge, we can hear you.
Okay, so can I go ahead now?
Yeah, go ahead.
Okay. Good afternoon, everyone. My name is Adedeji Adekoya from Nigeria, and I'm the first presenter for Group 6. Let me start by introducing the members of my team. We come from 3 different countries in Africa, Nigeria, Kenya, and Egypt. So here's a list of the members of the team. There's Jumoke Abode from Nigeria, Irene Ugoji from Kenya, Alan Wafi from Egypt, and Adedeji Adekoya from Nigeria, Christine Weir from Kenya, Bernard Keranja from Kenya, and Dr. Charles Ume from Nigeria. So based on the order, our presentation today will be from 4 rather, from Adedeji Adekoya, from Jumoke, from Christine, from Ala, and from Irene. So our product, Vent Connect, is a two-way ventilator. Our product, Vent Connect, is a two-way ventilator splitter that allows one ventilator to be divided over 2 patients. The concept of our logo, the concept of our logo comes from the essence of connecting 2 ventilators to one person, like having 2 people use one ventilator. So we'll start our presentation with the physical principle, then the voting section, the concept description, hardware, and finally the business model of our concept. I think Allah should be next now.
Thank you so much. My name is Christine Were, and I'll take you through the physical principles of a ventilator splitter. So as you can see on the screen, there are various physical principles, there are various components: one-way valves, splitters, flow restrictors, PIP valves, and filters. Onto our first component, the one-way valves. This is a non-return valve, and we'll incorporate them in all the inspiratory lines and expiratory lines of our ventilator splitters to prevent backflow of air. This is to prevent cross infections between patients and also to prevent ventilator from contaminations from our patients. So it's a very important component for our splitter. Then the next is a flow restrictor. This is a flow regulation system that will enable the users to adjust the flow so that you can control the tidal volumes. We all understand that different patients have different lung properties, from compliance, resistance, and elasticity. That means that each patient will have a specific tidal volume that will be required. And we can't provide all the patients that we connect on one ventilator with the same amount of tidal volume. That's why we need a flow restrictor to adjust the volumes. Then from there, we need filters. We'll have HEPA filters, HEPA mechanical filters on the exhalation lines of each splitter to ensure that any microorganisms, any bacteria from the exhaled air does not pass to the next patient. So before the air goes back to the ventilator to be released to the environment, we'll have HEPA filters to filter the air. Then you also have HME filters. These are heat and moisture exchanger filters. As we all know, the function of HME filters is to moisturize and warm the air, and it will be incorporated on the Y-piece of each patient circuit. Then you have the PIP valves. PIP means positive end expiratory pressure. This is the amount of pressure that you have to retain in your lungs so that the alveoli do not collapse. So we'll have the PIP valves also on our splitters to ensure that the patient's lungs do not collapse, and every patient have their own specific amount of volume that they can retain in their lungs. That's why we'll be incorporating different valves on each splitter on the exhalation end. Then you have the actual splitters that will divide the air from the inspiratory port of the ventilator to various lines. And that's all about the physical principles.
Thank you, Christine. Okay, so now I will talk about some of the ideas. So we identified a number of potential designs for the ventilator splitter. The designs were evaluated based on 4 aspects: the feasibility, performance, usability, and safety. We voted on them in the polling section, and we finally chose the highest ranked solution, which was the 2-way splitter integrating a 1-way valve and a flow restrictor, and that is the design on the furthest to the right. So the main issue with the 5, 4, and 3-way splitters is that there hasn't been enough studies done to test their effectiveness, especially on patients with acute respiratory distress, such as COVID-19 patients, and these are the patients being targeted. Also, these solutions involve more than 2 patients, and there is a higher chance of suboptimal ventilation, and it's much more difficult to control tidal volumes for each patient. The 4th idea was to design a 2-way splitter combined with a flow restrictor. This design was already developed at the Royal Women's Hospital in Australia. Its main limitation was the indirect flow of tidal volume from a patient with low lung compliance to a patient with higher lung compliance. This led us to the 5th idea. Here we modified the 4th idea to also include a 1-way check valve along with the flow restrictor. So for our final proposed design, our design is a 2-way splitter connected to the inspiratory port of the ventilator that will contain a 1-way valve and a flow restrictor for each limb. On the right side, you can see a sketch of the design. Incorporating a 1-way valve will prevent backflow of air, which is necessary because patients aren't identical and they could have different lung compliance or lung sizes. Okay, so also in the sketch, you can also see that it's recommended to use a number of other monitoring devices to insert in the patient breathing circuit to enhance control and safety. A pressure transducer can be added to monitor the pressure for individual patients. A volume meter can also be added for individual monitoring of tidal volumes received by patients. And it will allow, these monitoring devices will allow caretakers to visualize changes in tidal volume or pressure during the process. Okay, next. So, okay, so here are some of the published papers that we obtained all our technical and medical information from. So now here we have some of the available solutions. And so the first solution here, I mentioned and talked about it before. It was developed in Australia. Its main limitation is that so it does not involve it. It has a problem of because it does not involve. It doesn't. There is a problem of indirect flow from one patient to another in the case of different lung compliances. But the design was tested, and it was tested in the lab, and so basically they operated in pressure control modes on the ventilator, and they tested the flow restrictors, and they found that they can restrict flow, allowing more control over the process. Solution 2 has been FDA approved, and it has also been 3D printed using low-cost material from common medical devices. This solution 3 is an entire system that was developed in order to allow a ventilator splitting. It contains open source designs for vent splitters, flow valves, one-way check valves, and adjustable PEEP valves. It provides a solution for ventilator splitting on patients with different clinical characteristics. And finally, this is a flow restrictor. It has been tested on simulated, with simulated lungs, and it's safe to use on patients with different lung compliances. Okay, over to you, Irene.
Thank you very much, Ala. My name is Irene Ugoji. So I'm going to be presenting on the hardware. So considering the existing solutions, we looked for the major, all of them have a little problem with them. So the really effective ones are most of the times you have to attach many components together before you can get a fully functional working ventilator splitter. But our design consists of a single piece 3D printed splitter that actually can do everything. So now, as you can see from the design, the main part, the ventilator splitter, is there. Okay, I'll actually show you that in the next slide. But okay, so we're going to be using no, sorry, not next slide. Next, yeah. So we're going to be using the material ABS because it is actually heat resistant. It is chemically resistant to the ethylene oxide, which we intend to use to clean the ventilator part, and it is really affordable. Next slide, please. Okay, so this is our 3D model, a video of our 3D model, just showing different parts. So, yes. Okay, so now I'm going to explain the different parts of our ventilator splitter now. So we have the outlet to the patient. We have the one-way valve, which is used to. We have the one-way valve, which is used to make sure the air goes in one direction. We have the airflow control valve, which is used to regulate the amount of air so that two patients with different lung compliances can actually use this ventilator splitter and it will meet their needs. This air control valve also ensures that once a patient recovers, we can easily remove the patient from the ventilator splitter without affecting the other patients. So now we also have the outlet to the ventilator. And one beautiful thing about our design is that this is actually compliant with the 22mm ventilator outlet. Over to you, Jumoke.
Hello, my name is Jumoke from Nigeria. I'll be presenting our business proposal. For our proposal, our product, the two-way ventilator splitter, is vital since there are less than 2,000 working ventilators that have to serve hundreds of millions of people across 41 countries in Africa. The splitter not only saves lives by enabling two patients to use a single ventilator, it saves time in assembling the breathing circuit by integrating the one-way valve and the flow restrictor in the splitter. This means that for healthcare professionals, our design does not include you having to look for different components and trying to fix them during the emergency situations. Our design can be printed at once with the components such as the one-way valve and the flow restrictor, which saves a lot of time. For our potential clients, users, and channels, our potential users are the patients suffering from severe respiratory failure due to COVID-19. Our clients are doctors, respiratory therapists, and engineers using ventilators for COVID-19 patients. Promotion through advertisement campaigns in hospitals and clients are essential to passing information about our device. For the analysis of cost, production, supply chain, and services to clients, our device is going to be produced via 3D modeling, and one only needs to have the material, which is ABS, which stands for acrylonitrile butadiene styrene. This is a material that can be found with a retail price costing less than $25, which is way cheaper than buying a new ventilator per patient, which will cost up to $25,000. For the growth strategy, distributing the product information for mass production, making it readily available in hospitals will save a lot of lives during the COVID-19. Next slide, please. For our future work, due to the shortage of time for this bootcamp, we're only able to work on the inspiratory outlet. So we would like to work on the design for the splitter for the expiratory outlet, which will consist of one-way valves and a PIP valve. The image shown is the potential design for our expiratory configuration for the splitter. Next slide, please. So I would like to thank our mentors, Dr. Andy, Dr. Alicia, Dr. Nuret, for your time and for helping us throughout. I would like to say a big thank you to Dr. Carmelo for helping us and for helping us in organizing this bootcamp. Thank you for listening. Any questions?
For your presentation, I'm launching immediately the poll. So in the meantime, you can accept questions for your project. So are there any questions? So if there are no questions, this means that you were enough clear to be honest. It's a nice and applicative project. And I'm inviting you when you have time to keep working on the project and ask for support to your mentors, who I'm sure they can provide suggestion, but also like means for prototyping these tubes. So I'm stopping the poll in 10 seconds. Please vote. Consider, I forgot to say, but I'm taking the median of the votes. So if you are voting by yourself, putting 10, of course, is not going to be counted in. So I'm closing 5, 4, 3, 2, 1. Stop and poll, and we can ask people from group number 7 to join. Bega, I see you on fire.
Greetings, everybody. My name is Bega Mbonambi, as Mr. Camilo has stated. A young South African. Actually, doing my advanced diploma in horticulture, sustainable horticulture. So I'm very new in the field. And then one of my teammates just went AWOL, and then we were working with just 2 people. So don't be too critical about our presentation. It's just 2 people working yesterday. So I do not know how I'm going to do this. Like, should I share my screen on my phone, or can you, Mr. Camilo, assist me with the presentation that I sent? Like, if you could share that with the rest of us.
I'm going to take it in the folder. If you told me that it is in the folder, give me one second.
Please.
Show file location, folder, group 7. I have presentation of this one. Okay.
Yeah, it's titled UBORA presentation.
Okay, let me download it. I will open it with PowerPoint, probably because you created it using PowerPoint.
Thank you.
Okay, let me just, when I have to skip the slide, just tell me skip.
Okay.
Share screen. Can you see my screen?
Yes, I can see it very clearly. Thank you. I've introduced myself, stating that my name is Begambo Nambi. We worked with Mr. Samuel, and then lastly, we also work with our mentor, Majul. We call her Majul. So, yeah. Our product is, or the name of our brand or product is UNECA, which means hygiene, incorporated with the brand's name. So, skip please.
Let me try in this way. Okay.
Okay. The origin of the problem at large is COVID-19, which is a spread, which is in the accumulated through physical contact and mobility of people. And we cannot stress enough, we cannot repeat this fact enough until without us feeling like tired of hearing it. For the fact that we feel tired of hearing it, we need to be taught more about the corona, the virus itself, until we understand the depth of it. So the virus was first introduced, or was first spotted in China, and then it contaminates through physical touching, and our hands are constantly being used to touch surfaces to help us around in our daily lives every day. So our hands are the largest thread to actually being carriers of the product. Because whenever we come back to the house, the first thing we touch is by our hands. We touch everything throughout our lives. So that's why we wanted to focus the prevention of this virus through retaining and helping our hands actually become much more clean and actually become hygiene and do not pose a threat of carrying the virus in coming in contact with the virus. So can you please skip? The stats are actually very crazy, and we've just noticed that here in South Africa alone, the cases are growing in numbers. Like previously, it was just a few numbers. Now it's just like every new infection report every day about 3,000 people. 3,000 people per day. The people who are positive also. The numbers are increasing at a very rapid rate. And then also, if you look at throughout Africa as a whole, the infection rate is increasing, and it's due to maybe the ignorance that we have, saying that, oh no, this is not for us, this is not affecting us, this is not going to be a problem for us. So that's why I think it's much more reasonable if we always stress the seriousness of this COVID, of this pandemic, because it's really stressful. Skip please. Our goal is really to develop a clinical equipment that will enable fellow Africans to prevent the spread of the virus and any bacteria in the future, and that poses as a threat. So one of the things that come into mind is hygiene, cleanliness. Cleanliness is the next thing to godliness. That's how they say it. So washing your hands and always making sure that your body is safe and clean is one of the most effective ways of preventing any contamination and any spreading of viruses. Next, please. Description of the clinical need and users. What we want to really introduce is the product that we want to build is a stand, a hand washing stand that will enable people to wash their hands at the same time. Let it be foot operated, avoiding using hands, because touching of surfaces increases the contamination and the virus spread. And another big impact of this, that like when you use your normal, like the normal taps, like water is lost in like huge amounts, like other than like compared to like using your foot. Your foot is actually much more better at conserving and using water as you need it. We want to have a sanitizer disperser that is actually made out of green material, such because we felt it as if it's just such a small component, so it wouldn't be expensive to create such a platform for it. So it's going to be run by a solar panel, and then it's going to disperse the sanitizer and the liquid soap. And then after that, the person washes their hands, they operate with their foot. And then they wash their hands. As they're doing that, there's also a thermometer that is also sensing, which is also made out and powered by like solar power. And then by the time the person is done like with washing their hands, the thermometer is going to read out and record the temperature and the temperature of the person. So, and then the person is like has already like washed their hands, not touching any surface, also being able to get the temperature of like for permission to enter like facilities and public spaces. Next, please. The stakeholders really and the viability of this product is such of the fact of importance. The viability of the product is really like I cannot stress enough how vital it is, and it is one of the components that as Africans we need. Water is one of the major scarcity, and water is not readily available in some countries. Even here in South Africa, we still have problems with water. Like in some areas, water is not available to citizens. So the viability of this is actually it's one of those big opportunities at the moment. It's one of those things that actually can help us and our economy to really sustain it and develop it much more further. Skip, please. So this is the conceptual design. We took it online. The idea manifested through this. On your right side is an automated centering sanitizer disperser. And then on your left-hand side is a foot-operated tap and a sink that allows the person to wash their hands without even touching the surface and the tap. So that is the general idea around our product. And then also to incorporate the thermometer, as it is vital to read and state the temperature of a person, because one of the temperature is one of the symptoms of people that have that people are susceptible of having corona. So the next slide, just disclaimer. I'm my prototyping abilities are whack. They're non-existent whatsoever. So I tried my best to freehand and write this. On the left-hand side, you can see your top view, which is the tap, the thermometer, the soap, the sensing soap, and the washing basin. This is actually it has adjustable standing feet or legs that most of the surfaces are not up to plan and not very straight. So that is going to accumulate for that factor. And then the thermometer is 45 degrees slanted, allowing to come in contact with the person whenever they are reaching to wash their hands. And then the last view is for the countries and places where like systems, tap water systems are not available. So the water can be contained within the container. It is removable, and then you can connect it if you have the tap water. Next, please. Oh, thank God. Oh, questions and answer sessions. Thank you very much. As I stated at the beginning, that this was just done yesterday. One of all of our team members are experiencing problems through connectivity, problems of availability of data, so they couldn't stick with us till the very end, and we only got that to in the end. So thank you from my side. If there are any questions, I'd gladly take them.
Okay, before the question, so let me start the poll session. This is team 7. We can launch the poll, and we have 1 minute for question. So who wants to ask something? If not, Becca, I appreciate your attempt to do manual sketches.
Thank you very much. Thank you very much.
I can tell you that it's nice that at the beginning you were just names. Now you are name and face and personality, and I really appreciate the climate that we were able to create. But however, with you, I was not lucky because I always asking to write the group close to your name. We are I was not able. However, so I'm going to close the poll in 5, 4, 3, 2, 1, end. So the last 2 groups, now I'm inviting group number 8. So the last 3 groups actually. Group number 8. In the meantime, I will start to arrange the evaluation.
Good afternoon.
Good afternoon.
I am Lesotho Pitswani from group number 8,
okay.
The Game Changes. I have shared my screen.
Yes, we can see it.
Wonderful.
If you want to put in presentation mode, it's better. Otherwise, we can see the screen anyway.
Pardon?
If you want to put in the presentation mode, otherwise we are just seeing the slide. But it's fine. It's fine.
Okay. Awesome. Thank you. My name is Lesotho Pitswani from the Game Changers group, and that is group 8. Today, I will be taking you through our approach to testing and diagnosing for COVID-19. Our approach, our novel approach, is based on using chest X-ray images as well as deep learning trained AI to detect the patients infected. So I'll be taking you through our presentation today, going through everything from the clinical needs that we are addressing, all through the clinical trials that will be then necessary to take this innovation forward. So I'm sure after today, we are all familiar with the PT-PCR testing approach that is being used widely across the globe. Now, that involves a laborious, invasive task of genetic material extraction that is then put into test tubes and sent to the lab for testing. The cases are then, or the people then get their results after about a day or so. And in the meantime, the infected cases are unaware in the spreading of the disease. Then there is the antibody test, which tests if you've basically recovered, and which isn't the best test at the moment, albeit it's tiniest in its results. It doesn't give any indication as to the stage of the infection, as well as the rate. So both these approaches are, well, at least in the PCR approach, it's time consuming. It is not as widely accessible. You can imagine during a pandemic when there are lockdowns and import-export restrictions, that it can be quite a challenge to get the testing kits or the antibody kit to where they are required. Now, our approach takes advantage of the knowledge that COVID-19 causes a pulmonary infections. So it basically infects your lungs, and hence the symptoms that the people get. In our innovation, the approach is that symptomatic people can then present themselves to the nearest clinic or hospital, and the clinicians in those areas or the centers or the radiographer or technician can then perform an X-ray or chest X-ray, upload the digital image on as an input onto a software that's sitting on the desktop. Sometimes the desktop is part and parcel of the X-ray machine. Sometimes it's sitting on the side. Either way, the software will then analyze and as an output label cases of COVID-19 and those that are A-OK, and then it will also rank the cases from the most infected or the most severe to the least infected or the least severe. So currently, the use of deep learning approaches for diagnosis has been used to some degree in medicine. We have profound AI that uses AI for breast cancer detection in patients that are not showing symptoms, as well as IDX, which performs the retina analysis to flag or diagnose diabetes patients. So, as mentioned before, we see the solution or this approach being available and used widely in clinics and hospitals, primarily because across Africa, in urban and rural, you'll find that X-ray machines and the ability to carry out X-rays, scans is fairly, they are fairly common, and therefore, in terms of scalability and the ability to bring testing capacity to these remote areas, be it lockdown or no lockdown, pandemic, high volumes or not, throughout, they will then have this capability to do testing and diagnosis. So in pandemic times with high volumes presenting themselves to clinics and hospitals, it is the clinicians or the technicians and radiologists that can do once they've done the initial screening, that can do the chest X-rays. Once they have the output from the software, they can then have those patients that need critical urgent intervention or hospitalization, they can receive attention from the doctors, unlike everybody having to be assessed by the medical doctor. In this environment, we see the technology able to alleviate the volumes as far as testing is concerned. So with that said, data of chest x-ray data of COVID-19 positive patients, this COVID-19 is a novel coronavirus, so that data is not as easily or as publicly as accessible as you'd like it to be at this stage. Nevertheless, there's some work that has been done in the database of Dr. Cohen et al. At the University of Montreal, and the COVID-19 positive cases there are quite good samples to go by. Then there are other open data sets that one can access chest x-ray of normal and infected patients. However, part of our value proposition is the fact that our AI, unlike any other similar project that is being undertaken anywhere else in the world, what we are doing is we are training our AI machine with locally sourced data. So we've went some way to get anonymized, reliably and well labeled data, chest x-ray data of normal locals, and we've used that and are using that approach to build an AI machine that will be precise and accurate and localized in the African context rather, to be able to flag and alert of the COVID-19 cases. Now, we have used some to achieve the performance that we've gotten out of the machine. We have used Keras and TensorFlow, and basically using this aforementioned data to improve the UGT16 network that is also open, publicly accessible. So we just improved that. And a huge shout out to our mentors and the innovators on our team. It has really been an awesome bootcamp experience and a team effort. So what do we need? We need to carry out a clinical trial where we are testing patients or people that are presenting with symptoms or not. And then we, in an area where they're doing the test with the PT-PCR test, have those patients also be tested using the chest x-ray approach. And we will then compare those results and do the best that we can to maximize for true positives, whilst also minimizing for false negatives. And yeah, that is the next step as far as commercializing our product goes. And that is all from us. And this is where you can reach the different members of the team or the team. And any questions at this stage? Thank you. Any questions?
The microphone. So before the questions, that probably there will be some question. I'm inviting all the people to poll your project. This is team number 8. So launch the poll. We have 1 minute and something to vote, and we are waiting for questions. So, any question? So I hope that in this project, the keynote sessions that we provided were useful. You can get inspiration by those speeches. So 10 seconds left. I'm inviting the mentors to complete their vote. I want to say without problem that the vote of the mentors cannot be valid for their own group. Of course, you cannot evaluate yourself, and I'm going to take the median of the vote to avoid that too high or too low votes can influence the final evaluation. So stop in 5, 4, 3, 2, 1, stop. So now a very good votation in general, 24% of you gave a very good vote. I see all the data. Now I'm going to introduce group number 9.
Hello.
Hello.
How are you? May I share my screen?
Of course, you can go.
Okay. Oh, wait, let's hope. Share. Is it showing up okay?
Yes. Yes.
Okay, great. Hi everyone, my name is Pearl and I'm from Team 9. And we were tasked with creating a PPE solution. And so as a team, we decided to work together and create a scanning technology solution for PPE, which can be used to scan pathogens on PPE. The participants in our group, it was Lewis, myself, Yamikani, and Nakokonke. And then we had our mentors who are Rimuka and Rosho. So what exactly is our product? Our product is a scanner which will be used to detect pathogens specifically on PPE. And it will use the live properties of certain pathogens under visible light in order to detect these viruses and microorganisms. It will also give rapid results in terms of detecting viruses. This can be used to monitor PPE cleanliness, and the area for its use is public health, and it can be used as supporting equipment for health professionals at the front lines. The clinical needs that are being covered are the effective protection of healthcare workers, the tracking of contamination of PPE after a specific period of time, as well as the tracking of concentration of pathogens on PPE after a specific period of time, as well as establishing patterns in terms of how PPE is contaminated. It can also be used to create effective solutions in terms of how PPE could be decontaminated. And pretty much sorry, in terms of how we wanted this product to work is we wanted to take existing technology and just apply it in terms of scanning PPE. So as you can see over here, we have some existing solutions. One solution is PodSpot, and this is a product which is designed by an American company. And how it works is it scans hands, and through the scans that are created, it can find foodborne diseases on hands, and it can also suggest any ways in which someone could improve their hand washing skills and so forth. So it's really great technology. And then another thing which we used in terms of inspiration was GlowGerm, which is more of an aid which is used to teach people how to wash their hands more effectively. And it's just a gel which is placed on someone's hands, and then over time you can take a UV blue light and shine it on top of your hands and see what would be assumed to be germs, but not necessarily on your hands. So in terms of requirements, we needed our products to be able to detect the presence of contaminants. We needed it to be able to suggest more effective cleaning techniques, to track contamination patterns as well. And in terms of safety, we needed to try and make sure it is not toxic, that it uses a safe wavelength of light in order to detect germs. It is non-invasive, and you should also make sure that any user data is also kept protected, while also making sure that the electrical system is safe. Usability requirements, it would have to require little training, and any data generated should also be easy to interpret, and we understand that. The device is also aimed at being used in conjunction with other PPE cleaning solutions. So when we filled in the survey, we found out that our device is a Class 1 device, and these are the standards that it needed to comply with, in case you want to look over those quickly. And then when we move on to physical principles, so what exactly we wanted to use was potentially Raman hyperspectral imaging in order to find any pathogens on a PPE suit. And so what Raman, and this is pretty much how the setup works. And then over here you can see scans that are like generated through using these systems. We've placed links and everything. And pretty much these scans can be used to differentiate different things. So over here we can see that it differentiates between polymers. So we wanted to take the same type of technology and apply it in terms of differentiating pathogens from a PPE suit, and maybe even different pathogens from each other. This is the voting we had as a team on UBORA. All the information you find in this presentation will be on UBORA. And over here you can see what we voted for, all the other different things. So in terms of concept description, what we were proposing, is a panel scanner. So we're planning on, well, what we've proposed is a panel scanner which is set up like this, with panels in which someone can step inside like this. And within the panels over here, as you can see, there'll be a camera, sensor, and computing system. And it'll be shown, and it will be using glass and so forth, but the more will be explained a bit later. So in terms of hardware, the hardware that we are suggesting being used, we found inspiration for hardware. You can find the reference over here with these two scientists actually developed a low-cost solution in terms of Raman hyperspectral imaging solutions and everything. So we've used their model in terms of cheapest method to develop a Raman hyperspectral imaging system. And all of these systems and items will be used in conjunction with a spectroscopic camera, a glass panel, a computing system, and other types of firmware, as well as a plastic case or covering on the outside of the panel. The electronic and firmware that we need would be Arduino Pro Mini, spectrometer chip, Bluetooth module, a rechargeable battery, a power switch, and even more. In case you want to see software, we have found open source software which would have to be adapted for the product, and this software can be used to analyze the graphs, the scans generated from the Raman system. And the complete arrangement would work like this. And in essence, how it would work is light would be shone by the Raman spectroscope through the Raman probe, and it will be shone onto the person wearing the PPE, and it will be a visible light source, so it won't be harmful UV rays in case anyone is concerned about safety. And then depending on how that particles on the PPE equipment respond to the light, it will be sent back. And all of this will go through the camera, which captures the images, and through the computing system. And all of this data, despite there being a space in which it can be stored on the system, the aim would be for this data to be sent through on a smartphone or a desktop, to the user using either Bluetooth or Wi-Fi. We also did some stakeholder investigating. So the consumers would be healthcare workers and other people using PPE. The producers would be tech developers, producers of scanners and competitors. Partners would be WHO, EU, AU, universities, and UBORA. And in terms of owners, despite being the Shield9 team who has ideated this, we're also open to passing on this project for other people to research and develop a bit further. So environmental, social, economic impacts, and along the life cycle. So in terms of the design, we will be working to use locally sourced materials in order to generate work for people. You can also read underneath in terms of the pros and the cons related to the design and so forth. And then for production, the energy costs might change based on manufacturing facilities. So the estimate, and then if you look at the supply chain, you can see the estimated cost, which would be between $4,000 to $5,000, which is expensive. However, we're planning on designing this as a solution which is long-term, and it can be used to scan reusable PPE solutions. And then in terms of use, the scanners will be made locally and delivered by local delivery workers. And in terms of the end of life, we're trying to make the product recyclable. Thank you so much for watching our presentation. And we're still developing the solution further and trying to work as a team to see where we can go from here. But it has been really nice working together with all the people who I'm with. Are there any questions?
Speaking without the microphone, you can see me also a bit like looking in front of the camera. I have the other screen. So let me start the poll for team number 9, and then ready for question. You have the Tinico is asking for contact details of the presenter. So Pearl, please then be in contact with Tinico directly. Let me launch the poll. There is one question in which you are invited to reply. I'm a bit concerned about the health effect of wearing a PPE during the scanning.
Oh, okay. So someone's concerned about health in terms of wearing PPE during the scanning. So as you can see, if you looked at Hotspot and what they've developed, they've used visible light in such a way that it doesn't harm anyone. So when someone's scanning their hands, it doesn't harm someone in terms of scanning their hands. And as much as the diagrams have shown a solution where someone's eyes maybe make contact with the light, because you also understand that light exposure to eyes is very different to other parts of the body, we believe that it's very possible to develop a solution where you use visible light in a way which doesn't harm the human body. And we can even create a podium sort of solution which makes sure that someone's head is placed just above the scanner as well in order to prevent exposure to eyes. So things are still being developed, of course, but it is very much, it's very much a thing of we are not planning on using UV rays. UV rays are very harmful and other forms of light are very harmful, but visible light properties can also tell a lot about what's on someone's clothing, we believe, if we work more on developing the solution.
Thanks for, in the meantime, I'm closing the poll. Pearl, I'm inviting you to interact with Nico. You can directly send a chat personally. And then last but not least, I mean, I think we arrive at group 10, if I'm right.
Yes, sir.
So we have presenters from group 10, so take your time.
Good day, everyone. Can you hear me?
We can hear you, and we can see also your screen.
Okay. So my name is Sadiq from Nigeria. I'll be presenting for group 10. So our project name is Trace Africa. And our project topic is an alternative tools for efficient and effective contact tracing and isolation. As we all know that.
Sorry?
COVID-19 is no longer all of us to devise a tool or a way for isolating and tracing people that are infected. since there's no solution for it now, or there's no cure for it now. So these are the names of my group members. We have Mbafi Obed, the group leader, myself, Aziz Sadiq, and others, including our mentors.
Excuse me. I don't know if it is my problem, but I can just see your first slide. The one where you have Trace Africa.
Oh, is anybody having any other problem with that?
A problem?
Yes.
Yes. No, probably there is like a mistake. Now we can see the actual slide.
Yes, better now.
All right. So these are our group members. Mbafi Obed, the group leader, myself, Aziz Sadiq, and others, including our mentors. So this is the picture of myself and my other group members. So what is the clinical need? There is an urgent need to develop an effective approach for contact tracing and isolation of COVID-19 infected people. So that's why we came about this solution, which is called Trace Africa. So what will be the benefits of our device solution? It's going to provide a unique style of digital house addressing using the QR code. And also through our application, individual can use QR code, or individual that uses our app can link to their family and co-workers. It also improves privacy with QR code. So you are safe, our users are safe from people that can invade their privacy since they have a QR code, and it will be unique to each individual or users. So it also provides a means by which companies can screen their workers before getting or having access to their facilities. So if you are infected with COVID-19, if a company is actually using our app, once they scan your QR code, they will know you have contact with someone that has COVID-19 or you are infected, and they can always get to the COVID-19 response body in the locality. We also devise a way by which even non-smartphone users can also have access to our app, and they can be screened through the use of QR code. So the physical principle, Trace Africa uses IP address of various phone users are connected to the internet. Just as we all know that Android phone and iPhones are now very rampant, and they can be found almost everywhere now. Our app uses a software which has an integrated QR code that will retrieve individuals' information and care for the person's advantage. That's why we are using the QR scanner, just as I said earlier. It will work with the GPS through Google Maps, where users' touch points are recorded and made available offline through the QR code. This could be printed and pasted on wall, as well as we actually intended to use for non-smartphone users. So even if they don't use iPhones or they are not using Android phones, they can still get access to our service. So we actually conducted a voting yesterday on UBORA platform. So there are other ideas apart from our own. There's a particular idea where people use Bluetooth technology for tracing people with COVID-19. So it was scored 12.3 out of 20. And some people use GPS technology. They also scored 13.8. Our idea, which is the third one, uses GPS and QR code technology. It was rated 19.0 out of 20. So our concept description, we plan on introducing a GPS and QR code technology. So why did we choose this option? And the mode of operations, I will explain everything to you now. So we plan on using QR code to actually put our users at advantage for privacy improvements, to provide an alternative system of house addressing, and also so that our users can scan a house before entering it, and to alert them if a COVID-19 patient is living in the house. So also, we also provide an advantage for our users in which companies that have our apps or companies that actually uses that we offer service to can actually screen their members before allowing them access to their facilities. It is a software, and it's actually an application. It uses software, and the software is tailored to meet the local elements of every location the user finds himself. It can be customized to feature multiple languages and localized in the advertisement. So even if you don't understand English or English is not your native language, you can always use our app. It is very portable and long-term use. The maintenance will be done by both the manufacturer and the user. The facility requirements, the only thing we require from our users is an access to our internet and cellular phone network. So general product description, hardware system, we have the hardware, which is going to be the user phone, the system integration, electronics, and firmware. The commercial parts are not required at all since it's an app. There are no purposely designed hardware since it's actually an app tool, and no electronics or firmware. Prototype and function trials are not applicable to this software. So let me just give you a brief description about our software. We actually program it using Java and its environment language, Android Studio for mobile application, mock-ups for app design are shown in functional trial section, which I will show you later. So the general product description and the purposely designed parts. An individual with a smartphone will download the software from phone's application store, like Google Play Store. He or she will get interfaces to sign up and get unique QR codes, which will be printed and be used to check whether that person had close contacts in the past 2 weeks. The app will register contact information from other smartphones with similar app installed and stores for 14 days. If anyone in that network is tested for positive, the app will send a notification and SMS to all close contacts in 2 weeks. That is everyone that has a close contact in range of 1 meter to the person in the past 2 weeks. Additional interface where an individual gets access to daily check-ups, advice for COVID-19 and other tests are available. Furthermore, real-time monitoring and alarm when 2 persons are in close contact less than 1 meter can be a good reminder to actually remind people of social distancing. So in order to address other family members and friends who don't have smartphones, an interface is made to register other family members on our QR code. So you being our user, you can also register other people. And when that QR code is addressed, they are all addressed at the same time. Like now, if you have contact with someone that has COVID-19, when you get back to your house, so far you've registered your family members as under our apps, they will also send SMS to them. Finally, companies can check the health status of their employees by printing employees' QR code and checking if they had close contact with the person that is tested positive every morning before they have access to their office. It is an important step in screening and early measures to be taken because prevention is better than cure. A software application is also designed to help track contacts and store for 14 days or more. When an individual in that network is tested positive, it will send an SMS notification to all registered contacts, as I said earlier. The software shall be downloaded from the Apple Store or Google Play Store. So we don't really need much from our users, as we know the economic standard of all individuals before COVID-19 is not the same as now. So we don't need you to buy any other device, just your phone and your data. So by downloading the software and installing and enabling the GPS, anyone with the aforementioned requirements shall be able to use the application. You don't need any skills to use our app. So this is actually a picture depicting what our app looks like and our work so far. So this is the sign up. There's a sign up option by the left. And if you are signed up before, you don't need to sign up again, you just sign in. So one of the things we require from you is your phone number, and that's it. So this is how our app interface, front interface looks like. You can log in, there will be daily checkup, then other stuffs. You can add people, there's this icon, the second icon of the phone by the right. So you can add your family members. So this is the QR code I'm talking about. So once if you scan your QR code, if you had contact with anybody before 14 days before, you'll be sent an SMS. So these are the things you have to fill before you'll be able to use our apps. And these are the things we are going to ask you to know whether you have any infection or you have any symptoms of COVID-19, whether you have sore throats, if you have any muscle or body aches, whether you are running temperature, are your eyes red, and if there is any nasal congestion. So these are our work so far. So for our design for iOS testing compliance, this Trace Africa is a contact tracing application which helps in easy contacts identification and faster contact tracing to slow down or contain the spread of COVID-19 in the community. Our application or our service to people doesn't need to be in a particular place. Just a static device cannot help in tracing of people, because you can have contact with people before getting to that point or to that spot where the device is being put. However, the application shall not send false notification as we'll be working on that. That may perhaps add another problem. Therefore, software product quality standard of ISO or IEC 25,000 series of standard will apply. More specifically, ISO or IEC 25010 is applicable to software product quality. According to this standard, the application conforms to 8 product characteristics, namely functional suitability, performance, efficiency, compatibility, usability, reliability, security, maintainability, and portability. Users' privacy information management is very crucial to the success of this application. ISO or IEC 27701 is another standard which specifies requirements and provides for establishing, implementing, maintaining, and continually improving user privacy information management. In this regard, the application conforms to the requirements. The application is of QR codes, increasing the quality of user privacy management. So, instruction for fabrication of prototype, we created a markup of the app designed through proto.io. An individual would download an app from App Store and install. He or she has to sign up, get QR code generated by the app, and keep it printed. They have to allow location services as required in the application. Follow and monitor real-time activities and register encounters. They can perform daily checkups for the possible signs and symptoms through an icon which was included and I showed you earlier. You can add more people, families without smartphones, so that they can be traced together. Check QR codes and receive SMS notification. Value proposition: efficient and effective alternative for identification, contact tracing, and isolation of COVID-19 cases in Africa. We plan to improve privacy, post-COVID-19 adaptability, ease of contact tracing, self-isolating, greater COVID-19 awareness to the mass, especially Africa. So there are key sources and partners. Key resources: equipment, cloud storage, network, human resources. Key partner: we have UBORA, content creators, governments, corporates, Android studios, iOS, internet service providers, the medias, and bloggers. The business model canvas: potential clients, users, and channels reachability. Social media presence, target marketing, governments and corporate endorsements. Business relationship, digital marketing, Google Analytics, SEO, and SEM. Social media marketing too will also be part of our business model canvas, as we'll be working with everyone. The target market is ideally users who have access to smart devices. The software will adhere to the relevant privacy regulatory bodies. By adhering to privacy policies, we will ensure that the user's data is protected and users' information cannot be used for harm. By agreeing to the app's privacy policy, ensure us that we are also abiding by the relevant documentation authorities. This is heightened by deployment of internet security measures by internet security experts. These are business model canvas. I hope you can all see it. Business analysis cost $12,000, app design cost $25,000, and others. The growth strategy: we plan on advertising our products, also maintaining it so that our users will not leave. Premium subscription, downloads, Amazon model serving as a platform to communicate urgent information to larger audience. User environment: our intended user is everyone. No training is required in addition to the expected skill level of the intended user. No maintenance or calibration required by the user at the time of use. This technology will be used at urban settings, outdoors, indoors, and at home. So the summary of Health technology specification: it is a software e-health application. This software is a proprietary software to use. You have to download the app from App Store, whether you are using Android or you are using iPhone. The software is tailored to meet the local elements of every location the users find himself, and it can be customized to feature multiple language and localized advertisements. It is portable and long-term use. The maintenance will be done by both the manufacturer and the users rather. Thank you for listening. If there's any question, I would like to attend to them now.
So thank you very much. We arrived at, quite late, but it was a pleasure to listen. If you ask from the presentation, it's a bit better. Before asking the question, I let the poll start, so I can also complete the evaluation. 1, 2, 3, 4. So any question? In the meantime, I'm completing the votation. So,
Can't see the poll, Camilo.
sorry?
I can't see the poll this time. It's normally on my screen. I can see.
Are the other able to see the poll? I can see the poll actually. And some people already voted. So,
yes, I can see it.
Yes,
I can
saw
see
it.
it too.
So, okay, I'll figure it out. Okay, thanks.
You're welcome. Okay. So no question. So I'm inviting now. We have 3, 2, 1. And stop. So now we arrive at the end. We have few steps to comply with. So first of all, now I will open the breakout rooms. So all the mentors will join me just to briefly discuss the result. And then we will be back for indicating the most brilliant project. In the meantime, I'm sharing here in the chat a link with a questionnaire, an anonymous questionnaire, of course, that can be really helpful for us to understand how the school was effective and what to make to have a school, a bootcamp better. So this is the link I'll send to all of you here on the chat. This questionnaire is specifically for participants. So let me open breakout room. Stop recording.